only see 4 people. Okay, we are live. Well, good morning, everyone. I'm Brett Blankenship, Chair of the Board, and I'll call this committee meeting to order for the Board of Regents Thursday, September 17th at 8 a.m. I'll remind everyone that the Regents, as well as the presenters, are participating in this meeting by phone and via Zoom. And I'd also like to take this moment to welcome our newest Regent to the board, John Shetler. Regent Shetler is a 1980 WSU graduate and is returning to WSU for service, this time to serve on the Board of Regents. He was appointed to the board by Governor Jay Inslee on July 1st and an Amazon executive. I almost said amazing, but it's an Amazon executive, and currently serves as Amazon's Vice President of Global Real Estate and Facilities. And he and his team manage millions of square feet of real estate across more than 50 countries. And his knowledge and passion and talent will be a great asset to the board and to the university. I'd also like to welcome our new Provost and Executive Vice President, Dr. Elizabeth Chilton, to the meeting. And Dr. Chilton was formerly Dean of the Harvard College of Arts and Sciences at Binghamton University and recently selected as our Provost and Executive Vice President. Her official day was August 1st. I hope many of you took advantage of meeting her online. I've had the privilege of meeting her in person. So welcome, Dr. Chilton. The Regents will be conducting the meeting today as a committee of the whole, rather than breaking into separate committees as we normally do. And we will take periodic breaks throughout the morning. And that's our opening announcement. So having stated that, we will move into some informational items. And if President Schultz is ready, we have a Pullman community update.
Well, yeah, I'm here. Yeah. I decided it'd be a good idea to show up this morning. So first time this week. So everybody on the staff is excited that I decided to come in today. Let me just start off by talking a little bit about sort of the community COVID response. And then my colleagues are going to visit about some very specific items in academic affairs and other particular areas. I want to emphasize we've had a really smooth start to the academic side of the institution. We are finishing week 4 of the semester. I know we have our faculty liaison to the Regents today, Greg Crouch. He may wish to address this a little bit later, but I've been really pleased how our faculty have done a great job getting the semester started. It's been very smooth. We've had good working relationships and continue to have that with our faculty and staff. And as I look around the country, and you had areas where faculty were suing the administration in an attempt to stop in-person activities, or the recent events at the University of Michigan, it's just a reminder that working in a collaborative sense here has really gotten us off to a really great start with our students and our classes. We announced a $3 million new endowed chair, excuse me, in Connors this last week, and continue to do a great job with fundraising. I want to make sure that we celebrate several times during the day our fiscal recovery this last year. So while we're going to talk about COVID-19 stuff this morning, and it's easy to kind of focus that that's the only thing that's there, I just want to remind our regents and everybody else that we've got a lot of really positive things happening at the institution. The leadership team is doing a great job. In terms of COVID-19 in the community, you're going to get some more details from several of the other people, but let me just talk about some broad brushstrokes. We have continued weekly, sometimes daily dialogue with a lot of the community leaders, including Mayor Glenn Johnson, the SEL, Schweitzer Engineering Lab CEO, and President Ed Schweitzer, PRH, Pullman Regional Hospital, CEO Scott Adams, Whitman County Public Health Director Troy Henderson, Pullman Chief of Police, and others. So that communication is going on a lot. And I will say I'm really proud of the fact everybody's rolled up their sleeves in the community to try and work together. And there's really good communication between all those groups. We've had a couple letters, our communication piece has been in the local newspaper. We had one that was this week that talked to, it was the two mayors of the two communities. It was myself and Scott Green, the president of University of Idaho, talking about, hey, masking up. And it's a campaign in the two communities to make sure we keep that education going around COVID-19. We also put something about 2 weeks ago, I think I forwarded to the Regents, that was just a reminder the university's been planning on a lot of different things over the summer, and just a bit of a reminder of the town halls and other communications that we've been very active in doing. We also want to continue to emphasize that we've had to be flexible and we've had to pivot as needed. And I think Mary Jo can talk a little bit about this, but for example, in working with citations in the community and things like this, we started in one place and we've continued to evolve that, working with our town council, working with the Pullman police, working with student leadership on the right things to be doing there. I will say clearly, members of the Pullman community aren't happy with the COVID-19 increase. And, you know, if you were living here, you wouldn't be happy with that either. So we continue to try and be steady, to try and communicate openly, to continue to pivot and do new things as we need to learn from what's working and what's not. But we certainly will, and I will need to make sure that we continue to maybe rebuild some of the relationships that are not broken, but they're certainly a little bit strained right now as the COVID-19 cases, positives, have increased in the Pullman and Whitman County area. And finally, just so you all as Regents know, there's lots of other things that we could or should be doing. And I hope we have some discussions from you all about things that you would like to see the university and how we respond. I want to remember we've cut nearly $50 million from our budget. We have something like 300 open positions, and we are maxing everybody out right now that we currently have. So I've been trying to be really careful about, we got to do this, we got to do that. And I shifted purposely the senior leadership team about 3 weeks ago and said, we need to stop worrying about everything else and focus around COVID in the community, testing, and those types of things. So purposely, there's some things that we might have normally done that we just felt this was a crisis and we needed to make sure people were focused around that. Now, as testing improves, as our positives decrease, and as you hear about those types of things, we got a lot of things moving in the right direction. We need to reshift back to more external communications and things like that. But I wanted to let everybody know we're not dropping the ball, but we had to shift focus as a senior leadership team over the last month. So with that, Brett, that constitutes my community update. And my colleagues here have a lot of more quantitative information around testing and academics and fiscal affairs and so forth. And look forward to hearing from them.
Thank you, Kirk. Does anyone have any questions while Kirk's up, queued up? Thank you. Then we will move on. Informational item, academic affairs update from the provost, Dr. Chilton.
Hello and good morning, everyone. I'm really pleased to be joining you for my first Board of Regents meeting. Fortunately, I've gotten to meet most of you via Zoom over the last few days, and I'm looking forward to being able to see you in person as soon as we're able to do that. So first of all, yes, as Brett said, I joined WSU this summer. I actually moved up my start date to July 15th. And I ended my position as Dean of Arts and Sciences on June 30th. So I had about 2 weeks to get here, unpack, and get ready to go. And it was the reason I moved up my date is that it was really obvious that we needed to do some hard work, as I had been doing at my previous institution in New York, to really determine the best way to offer the best academic experience for our students in the middle of a global pandemic, unlike anything any of us had ever experienced before. But what I quickly found out was that WSU was really well poised to make this pivot. First of all, the entire nation, in terms of higher education, did that pivot on an emergency basis in the spring. And over the summer, our faculty were working with our global campus leaders as well as our academic outreach and innovation to really be prepared for whatever the fall might bring. And even though we were planning to offer a larger proportion of in-person courses this fall, we knew we were going to have to offer and be able to pivot quickly. And so our faculty were working hard over the summer on not just how do I take my in-person experience and make it remote, but how do I redesign my courses? How do I ensure that students can still interact and are not just consuming information, but are really able to interact and take part and work in small groups? So they really stepped up. And when I arrived on July 15th, was around the time we were deciding whether we were going to, move a little more remote than we had been planning to. As it ends up, we were already planning to offer maybe about 20% of our class course experiences in person, because so many of the large classes we realized with HVAC and social distancing, we weren't going to be able to do that. And I'm speaking now about the Pullman campus, but the other 4 physical campuses were likewise planning for a mix of in-person and remote activities already. So when we made that decision to move to primarily remote, I think many of you know that we also ran an exception process so that we still have quite a few classes and academic experiences that are being offered in person. So we are not out in that sense. In engineering and in agricultural sciences in particular, we have a number of in-person classes or class components. And so as we look to the spring, we're looking to see what we can expand in that direction. But I do just want to give a shout out both to Dave Soleil, the chancellor of our global campus, to our academic outreach and innovation, and to our faculty. This fall, academic outreach and innovation has also been offering workshops both for students and for faculty throughout the semester, so that they can get the most out of the remote learning experience. And we're also ensuring that our faculty, staff, and students have Wi-Fi hotspots and Chromebooks or the technologies they need. And as far as I know, every one of those requests has been able to be honored. We've scraped together the funds to put that together because obviously the access to technology is one of the critical factors determining success in the remote environment. So I'm happy to answer any more questions about that, but the last piece of information I wanted to update you on, which you may be curious about, is our enrollment to date this fall. And so I do have one slide, and whoever can hit the button on that slide, appreciate it. Thank you very much. This data should be in your board packets, but this is hot off the press. This is our newest official data for fall enrollment. And you'll notice a couple of things. First of all, our system-wide enrollment of 31,159 is down less than 2% from the all-around high last fall semester. So while it is down a little bit, it is far better than we feared. Many of our peers across the nation are experiencing far more dramatic declines in their enrollments. We're happy that we maintained both our ethnic diversity across the system as well as our percentage of first generation students. Enrollment at WSU Pullman is down about 1,100 students to 19,900. That's where a lot of the declines are. But many of them are freshmen who have now deferred to the spring or to fall 2021. So they haven't been lost, but they have deferred, and we're hoping to make sure that we keep those students interested, engaged, and look forward to welcoming them when they arrive here. The WSU Health Sciences has the largest enrollment in its history of 1,727. And not surprisingly, our global campus saw the largest increase, enrolling a record of over 4,000 students, which is about 756 students from last year. So a 23% increase. So all of this is very positive. Obviously, this is really important to us. This combined with our educational quality that I really feel strongly we've been able to maintain. I really am very happy to have joined WSU at this time in its history. So I'm happy to answer any questions.
Any questions for Elizabeth?
I have one question. I was curious if you were seeing any of the increases in the global total enrollment being kind of the result of a shift from other campuses. So are we seeing students that may have been interested in in-person in Tri-Cities then shift over to enrollment in the global campus? Is there any of that happening?
I think some of that enrollment increase it does include students who otherwise would have been in person at one of our campuses. You know, whether they stay in the global as a global campus student or not. I don't know if Dave Soleil is on here in terms of the exact proportion of students who were transferring in from one of our physical campuses, but I do know it includes some. But I could obviously get you that number from Dave and follow up with you.
Well, this is much better than I anticipated it would be given our current context. And so a lot to celebrate here. And certainly I mentioned this yesterday on our call that having Dave's voice in one of the recent town halls and really reassuring everyone that we know how to do online learning and that this is something that we're doing on a regular basis, and the power and the magnitude of what is done at the global campus level was really impressive. So these are some good numbers given where we're at.
Thank you.
Yeah, Elizabeth, this is Dave.
Oh, hi, Dave. Thank you.
Sure. Yeah, the change, our change of campus numbers are really not that much higher than they are traditionally over the course of a fall or spring. There could be a number of students who were going to be freshmen on one of the physical campuses that enrolled in global. But as far as we can tell, many of these students that are new to us are true global students. There are some campus-based students that have converted, but the number isn't significantly higher.
Thank you, Dave, and a very public shout out to you and your team.
Thank you.
This is Marty. So thank you for the report. A couple questions I have is a little bit more of trying to look to the future here. So one, what's your sense, and I'm looking for anybody on the leadership team here to respond to this, but I think that we have a little bit of a reputational risk at the moment with some of the public relations that has been surrounding and swirling, in particular for Pullman, as it pertains to COVID and just kind of, you know, what I would deem personally at times as a bit of an unfair bias on the party culture. And we certainly, you know, our governor was less than helpful on his trip over to Eastern Washington as a whole, quite frankly, between apples and quotes like Animal House partying, but that has an impact over time. And so I'd like to kind of hear whether that's from Mary Jo or others of, do we see a long-term potential impact of seeing some of these freshmen that perhaps deferred may not be looking to ultimately return? Are we going to lose them? And how are we working to keep them? And I'm not even just saying about WSU. I mean, I'm worried about a lot of freshmen who have deferred and all of a sudden have, you know, a job at Walmart or wherever and are making a strong minimum wage, and it just doesn't make a lot of sense, you know, in 6 months now to go back to school. And then also WSU's kind of area in which what are we doing around brand management and reputational risk as it pertains to, although I 100%, I listened to the news this morning, Kirk. I mean, I believe we're on the downhill slide for the moment of COVID as it pertains to the hotbed in Pullman. But I'm just open to anybody's kind of thoughts around both those concerns that I have.
I mean, I guess I will say a couple of words, but then I'm happy to pass it on to people with to talk about other pieces and with greater institutional history than me. But you know, what I will say is when I look at higher education, you know, and many of us here, you know, read the Chronicle and read Inside Higher Ed and have colleagues who are at institutions across the nation who are dealing with exactly the same things that we are. And, you know, I don't have a crystal ball, but what I would say is institutions like WSU that already have a strong brand and already have a very stellar reputation in their states are going to fare pretty well because young people still understand the value of a high quality education, you know, for credentialing, but for their lives and to get them connected and on the pathway to their futures. And the value of that, I think, is what is keeping us holding strong, and I think will continue to do in the future. You know, the reputational, the community reputational, if you look at universities that include a campus like Pullman that is in a fairly rural area, but a fairly large campus like 20,000 students, all of those towns have seen influxes and increases, every single one of them. And we all knew that this was likely to happen. It was one of the factors that led to our decision to go mostly remote this semester and to set up the testing that we have. So, you know, I'm happy for others. Mary Jo, if you'd like to comment on some of the other branding aspects and what we're doing to reach out.
Yeah. If I can, Mary Jo, first, it's good to be president, right? Anyway, two things. First, Marty, I think I've been really excited and pleased with the work that a lot of our academic units have done on student recruitment during this time. I think engineering, I know Vancouver, several places personally called every single incoming student to talk about what they could do to try and get them on board and things like that. Personal touches that we had not done in some time, people went way out of their way to try and do that. And I think that's positive. I think there was a sense of the way we've done it in the past isn't going to continue to work moving forward. And I appreciate that. We have taken a reputational hit. I don't think there's any question about that for a variety of reasons. I love being in the New York Times for good stuff, not being a hot spot for COVID-19 around the country. So I talked to Phil about this yesterday. I know he is on the call as well. Mary Jo, I apologize for interrupting. Maybe you want to go. And then I think Phil and his team do not have a lot of bandwidth right now, but we may need to hire somebody externally to be able to assist us with this moving forward. And Phil's prepared to talk a little bit about that as well, Marty, but thanks for bringing this up. Mary Jo?
I think Phil should go, and then I can follow behind Phil.
All right, thank you. We actually, Regent Dickinson, we've been watching our tonality score in media coverage. We do have a tool that allows us to look at what does that coverage look like. Despite the way it feels, the net tonality score is only down by 1 point. It's a -1. So a lot of the coverage has been neutral. I'm looking at the report right now. 87% of the coverage has been neutral, 6% positive, and 7% negative. So I think that the comments that Provost Chilton made are accurate, that this is an issue that many universities across the country are facing. I agree with you. I am not happy with people continuing to bring up this idea that WSU is a party school. I have to say, I was walking around the community over the weekend and saw someone had spray painted a sign on the side of their apartment that said "More Animal House," and it just made my blood boil because that is not the message we want to be communicating. The other thing I'll say too is I think it's unfortunate because my sense is that the vast majority of students are doing the right thing. There are a handful of students who are not. I know that our student leadership is working diligently to try and make sure that people understand what they need to do and make sure that they do it. And so I'm hopeful that we are moving in the right direction. All that said, I think if this is something we want to pursue, I think we need to go beyond just looking at the tonality scores of media coverage and really actually do some polling in the state to get a sense of how serious of an issue is this. Once we know what that looks like, then I think we can talk about what next steps might be to rebuild that reputation if there truly is an issue.
Well, I would love to hear from Mary Jo. But Phil, what I would say, is even COVID aside from kind of what we've had to experience in this little kind of crisis communication hotbed you've had to serve in for the last, 90 days, I do think that it would be interesting because of Kirk, I wasn't aware, and I love the concept of the, outreach. And I know we've done similar things here in Spokane with our med students, and there could be some value, Phil, to truly looking at a true brand study for Washington State University. I think COVID, with the new medical school, with the work the engineering group is doing, the amazing work Connors is doing, it'd be interesting to me and as a regent to kind of understand that at some point so that we have a foundation to start to operate from and a strategic plan as it pertains to the brand. And we could be pleasantly surprised, or we could see, wow, we're really kind of struggling in this particular demographic in this particular area. And that would allow Mary Jo and others too to be doing some really kind of specific kind of narrowing in on that. So I think a brand study of some kind to not only understand the risk and the hit we've taken, but perhaps maybe the benefits that we also could be leveraging.
I wholeheartedly agree with that. That's something that has been on my agenda since I got here 3 years ago. The issue has been funding. And it was something that as we moved out of our fiscal recovery period, this was the last year, my hope was that the next year's budgets would be in a place where we could add that to my budget. Obviously, COVID has changed those plans, but I agree with you. I think it is something that, as an institution, we need to do. We have not done it in quite a long time. It is something that we should do on a regular basis. We really aren't doing the polling and market research the way that I think other institutions do. And so I would certainly welcome having that conversation.
Yeah, and part of why I wanted Phil to go first is because I think we have to ask the question is, where did the brand take the hit? And what I will tell you with students, we have a really strong deferral number. And that's an important thing to remember out of all of this. What happened in terms of what we did with those students is we actually made calls, not just from residential life, new student programs, our orientation. We probably got 2 or 3 calls. Are you planning to live in WSU? Where are you going? What do you need from us? We also did a lot of coaching and counseling if students didn't want to leave to go to different campuses like Global, like Vancouver. And so I think we need to see it as a system versus WSU Pullman. I think that would be my first observation, Marty. I think the second piece is that because we have this substantial deferral number, it does mean that there are connections to it. And so what I've done, and in the division we'll be doing, is we're going to actually be having town halls with me as the vice president. For those students who are remaining at home, we are also going to have a town hall for those students who deferred. And so it really is the way for us to keep connecting with students more broadly. It's a very different environment, and it will be probably for the next year, and how we engage students, but that's going to be our plan. We've also talked as a system that student affairs also needs to figure out how to connect with its students in its area. So just because a student is a WSU Pullman student and lives in Vancouver doesn't mean that there can't be some outreach from WSU Vancouver. And I think those are the dialogues that we're having internally to make sure that those connections to students and that the desire for students to attend WSU wherever they are, which really is our philosophy, right? Wherever they are to be successful, even if they're on Global and across the nation.
Can
If
I
I could
ask
add-
a question or two or make an observation or two?
Yeah,
Brett, do we have time
please
for
do,
that?
Heather.
Okay, great.
Yeah.
So I think we have two issues. One is sort of the substance of what we're doing, and then there's the communication issue. And we just talked a lot about the communication and branding issue. But I feel like we've kind of lost our mojo to some degree in terms of the substance too. I mean, this is such a golden opportunity to not sort of play defense and not explain sort of why we're just doing the same thing every other university with a small town as its sort of central focal point for its largest campus is doing, but instead, how do we exceed expectations and how do we innovate in this time of challenge? And I would like to hear more about that because I feel like we're on the back foot a lot and kind of spending time explaining how we compare to others and how this is sort of an inevitable problem as opposed to kind of how we're leaning in. And we are leaning in on some things. I mean, our lead in online and global is great. And we should do more around that in terms of accelerating that and taking advantage of this opportunity to really expand that program and to lead in that area. And there are probably some other things as well that I'm just not thinking of. I remember being very excited about what we were doing with the veterinary school and ramping up some of its capabilities to add to the testing capacity of the state, et cetera. So I'd love to see, sort of a short list that we as Regents get updated on of ways that we are innovating and leading as a result of the crisis, not sort of coping with the crisis. And when I say crisis, I mean very broad strokes, not only, the actual disease, but the economic effects associated with the disease, the impact on mental health, the acceleration of digital everything. There's just a lot of impacts that we can either mitigate or we can take advantage of. And I feel like we need to kind of have that list of what are we taking advantage of and how are we enhancing our leadership and our position in higher ed as a result of the crisis. And then on the communication side, I wholeheartedly endorse what Marty said. I feel like we've been lagging in that area for a while, and we need to do more there. And now is certainly a time to do that. And we need to not treat it as being a one-time thing. This is something that in this fast-moving environment, we're going to need to be doing continually. Our perception in the market is going to be very fluid, and our messaging needs to be very fluid because it's such a rapidly changing time, and higher ed in general is really going to be subject to a lot of pressures. So I know we're trying to save money everywhere and everybody's taken a lot of hits in terms of budget on that. But if there was a place that I would overinvest in, one of them would be communication and all of the branding and messaging that's associated with that. So those are just my thoughts on the sort of the big picture. And then I think for Regents, I'd like to hear more about the deferral number. I'm not sure if that graph that Elizabeth showed was enrollment, including people that deferred, or I'm just confused on that number, and I'd like to understand that more. And then I'd also like to see some more data on some of the impacts that we're seeing in our student body, whether that's, technology needs, mental health, sort of data, sort of what are we seeing in terms of trends on burdens on the system? Are we getting more requests for emergency technology help, laptops, et cetera? Are we getting more requests for mental health help? How is all that tracking, and are we adequately resourcing some of those needs?
Just a quick one, because those are great points, questions, issues. But just to respond to your question about enrollment, those are students who are actually enrolled in classes this fall, and there are details, campus by campus details in your board folder if you're interested in that breakout. And if you have any questions following that, please do let me know.
So that means that with the deferral number, I'm just trying to get this pretty high level. I know we've got a lot of detail in the board book, but with the deferral number, we actually would have been way ahead on enrollment for this year relative to last year.
Yes, although, you often do expect a certain amount of melt, as they say, over the summer, right? So we accept a group of freshmen, and they sometimes accept us, say, yes, I'm coming, but then often, even in a typical year, they change their mind. They, now some of the other universities even try to pick them off even after they've accepted and said they would come here, and this is very typical. So it's hard to know if in a typical year. I think we probably, just guessing, and others can chime in who might know better, but I would say we would probably at least have matched where we were last year, which was our highest year ever. So a lot of it'll be interesting to see with those deferrals, because we will obviously accept new students at the same time. It'll be interesting to see if we're up again next fall. We are bringing in, just as an aside, we're bringing in finalists for a vice provost for enrollment management. We haven't had a full-time vice provost for enrollment management in the recent history. We've had a half-time person who's been doing a stellar job, but this will bring in a professional. We have stellar finalists. This is a search that was started long before I came, and is going to be a key factor in some of the issues that you're raising.
Great, thank you.
I'll put together like a 2-pager on some of the innovation stuff that's going on. I've had several VPs email me during this conversation, reminding me of stuff that we're doing in the COVID-19 time. So I'll give me 2 weeks to actually put something together. I will not inundate you with a 20-page document, but I'll hit some highlights. And I think we do have a lot of innovative stuff going on, and we've probably been a little more singularly focused in other areas. But I agree with you. We need to take advantage of this opportunity. So I will get that to you. I'll get that to the Regents. So.
Well, thanks everyone. Were there any other comments to that point? I would add to what Heather and Marty said, that we may open up while we're contemplating some of the marketing or messaging, due to the pandemic and the way society is thinking of things, we may be at a pivot point where the global campus may be one of our shining stars, and some of the online attributes of where society may be and in what we deliver, that may be a genuine focus for our marketing efforts. And those are just some of my thoughts while listening and observing. So next on the agenda would be the COVID-19 testing strategy with Dr. DeWald and Colleen Kerr. Are y'all ready?
I think we are, Regent Blankenship. Thank you very much. What we'd like to do is give you a brief update and then provide you the opportunity to ask questions that you would like to ask around how we are doing the testing right now. We have a couple of slides, and I'm going to attempt to share the screen, and Vice President Kerr and I will kind of toggle back and forth. So I will try to get us started. I hope everybody can see the slide on the screen. Give me a thumbs up if you can see it, please. Okay. So what we wanted to talk about is an initiative and the group that is involved in the planning and the delivery of the testing, attestation, contact tracing for primarily the Pullman campus, but this will also be ultimately a system activity. So many of you are aware, and I believe that Regent Redmond already addressed this a little bit, but several months ago, the university made a decision to move toward having a testing capability that was fairly large scale. At that point, there was a decision to invest in the vet diagnostics laboratory so that it could do human testing. There was significant funding for both the materials and equipment to transition. Our vet diagnostics lab does have approval at the state level to do the human testing, is well underway doing that. We currently have a voluntary testing program for our students. It is in Pullman. We are moving toward expansion of that program to other colleagues. We also have a certification testing program for our health sciences students. So why would we do testing? It's to address the individual and the population health. So individuals who may be positive so that they can take appropriate action, for our population to take action on the part of the individuals and the organizations so that we protect them. We are collecting information steadily as we go to inform our institutional decision-making. We are working across our academic affairs, student affairs, very deliberately and constantly so that we can inform the decisions, for example, that would come from Provost Chilton or from Vice President Gonzalez, what would happen at our system. We have found that this is proven to be a time of highly collaborative interaction, and I'll ask Vice President Kerr to address this some, but we are working at the state level with the Department of Health. We're working with our regional county health departments almost daily, and in fact, Vice President Kerr just exited a meeting with Whitman County. We are working with other organizations, including our partner, to deliver the large-scale testing capability, and that is Insight Diagnostics. Further, we are working with higher educational institutions, and in fact, I won't go into details, but many of them are very pleased with what we are providing for them in terms of the testing capability. So what I'd like to do is go ahead and hand the baton to Vice President Kerr and let her talk about the programmatic initiatives for a moment.
Sure. Thanks, Terrell. Good morning, everyone. So let me actually start by saying we have a great partnership with Whitman County Public Health. So I was just on with them. We meet every morning with Whitman County Public Health, Washington State University Environmental Health and Safety, which holds the MOU between the university and the county, and with SCL. SCL joins us as the largest employer. They also have a testing program. And so that's been part of what has influenced or informed the development of where we're at with respect to testing. So let me just walk through the quickly and then provide a little bit more information. So we have attacked information for that's on the next slide, which we can show in a minute. So Daryl and I co-chair that. It's to address and to coordinate testing, attestation, and contact tracing. So it's to plan internally, but also to plan and coordinate externally. We also have, I want to give a brief update on One Health Diagnostics. We've talked about that at the previous two Regents meeting. That was taking Waddle, our animal diagnostic lab, and then bringing it online through the regulatory process to be available for human testing. So that is up and running. I want to give a lot of accolades to Dr. Palmer, Dr. Baszler, Chris Mulick in my office, and Rick Desimone, who I also work with. That was a really strong collaboration working with the Office of the Insurance Commissioner and the Department of Health. It has significantly added capacity. With full capacity, we'll be able to do about 1,000 tests. So any samples that come in from a variety of different partners, Dr. DeWald can talk about the work that we're doing to support Whitworth and Gonzaga, in addition to supporting our own student population. But there are many who are availing themselves of the testing capacity that we have been able to add through One Health Diagnostics. We also have expanded testing through the Army National Guard and through Range Health. I'm going to let Dr. DeWald talk about Range Health, but the Army National Guard was actually a direct result of the collaboration that we have between WSU and Whitman County Public Health. FEMA funded 5 units to be in state to provide expanded testing capacity wherever they are needed. 2 of them have been at state penitentiaries. 1 of them has gone back and forth between Chelan and Okanagan. The other has been in Franklin County, and then the one that is now in Whitman County has been in Yakima County. The reason that it was able to leave Yakima County is because there were volunteer healthcare providers who came to Yakima, which was able to relieve the Army National Guard unit. They're phenomenal. They, work in collaboration at direction of the governor's office through emergency management. They are funded by FEMA. There are aspects of it that are not fully funded by FEMA, and we want to be honest about that and direct about that. But they come to Whitman County. They are incredibly self-sufficient and self-contained, and works in strong collaboration with us and with ICS in terms of where to go to address student testing. They are allowing us to have capacity to bring screening testing online for a Cougar card carrying population. So as Daryl said, we're online for students right now, and our goal is to next week, hopefully as soon as Monday, but perhaps later in the week, to be online for anyone else who carries a Cougar card. So faculty, staff, and employees. The way that we would attach that to make it meaningful in terms of a testing population is tie it to the attestation. So if you are using the WSU daily attestation on a regular basis, then we would ask you to participate again on a voluntary basis in the screening program. What I will say, let me talk just quickly about screening testing in the state of Washington to provide a context for everyone, because this has been a learning process for all of us. It's really important to acknowledge that we're the first school out of the gate. Kirk and I, President Schultz and I did, and Vice President Gonzalez did a meeting yesterday with the governor, other university presidents, and many students from the four-year institutions. And we're number 1. So we end up being the pilot, and we end up kind of really seeking to understand how this all works. We have all collectively in the state of Washington had a lot of confusion about how screening testing works. The long and the short of it is that the model that we have done in our state is that individual organizations, whether it's labs, whether it's a Walgreens, whether it's an employer like SEL, they have set up their own screening testing programs. We actually don't have a single county that has written a public health order for screening testing. And so that's the model that we have pursued. It took a little bit of time to understand how that was going to work. So we've had a really strong collaboration with Palouse Medical, who has written the order for us so that we, akin to what Schweitzer is doing, are setting up our own screening testing plan. And that has been the work that TACT has done. Daryl, do you want to take it back and talk about Range Health for a moment?
Sure, and thank you, Colleen. So we've been pleased with the team effort to increase our ability to do sample collection. Cougar Health Services has been tremendous in terms of stepping up. The Army National Guard is a partner coming in, but Range Health has been a benefit to the institution. Range Health represents the clinical practice plan of the College of Medicine, but it's more than that. It is College of Medicine, Pharmacy, and Nursing. And some of you may have seen some of the press and media regarding Range Health, a mobile unit that was deployed to Pullman, but it's much more than that. It represents the collaborative effort to build our community health care delivery. So in addition to the Range Health, what we've done is we've maintained collaborations across all of the primary operational areas at the institution. So Vice President Gonzalez has been directly involved, is on the TAC team. Vice President Elliot Cheslick has been involved. Vice President Weiler has been very involved. And what we've done is we can move forward relatively rapidly with this team of leaders. We've been very pleased to have Provost Chilton in the mix and providing guiding insights in how we work. What I would say is we have a committee that makes recommendations to the President's cabinet, serving as the executive policy group during this ICS time. But we're also relying on some terrific colleagues who are really doing the work in the modeling and testing subcommittee. And you can see those folks here, but what I would say is I think it's appropriate for us to now just transition so that you can ask questions. There's much more to come. It's very dynamic. Every day seems to bring new information and new requirements for us. So President Schultz, to you, but if Kirk, you want to say anything in addition to that, or Elizabeth, or I know that Mary Jo is going to segue right in with some of her comments, but there we go. That's a brief update.
Thank you, Daryl. Any other comments?
Daryl, can you speak to the accessibility for Washington State University to get access to the rapid testing as it pertains to the mouth swabs and kind of what that looks like, and where are we in line with that? I certainly know there are other universities doing that. My daughter just had it done at the U of A and has that done kind of on a regular basis. So I get there's a cost to it, but it also sounds like it's a less expensive means to get it done once you can kind of get access to it.
Yeah, and Marty, what I would say is Tim Baszler and Guy Palmer and some of the rest of us are constantly scanning the utility of these different types of tests. And part of what we're confronted with, and I think you know this, is the marketing piece of a lot of the testing. They don't tell you all the details. There's a degree of utility. So first, our diagnostics lab leadership is looking at this all the time. They're looking at the capability of those types of tests, and they're trying to acquire them as well. Right now, we have a tried and true capability. We're trying to increase the turnaround time on that, Marty, but we are looking seriously at different types of tests in the near future. Excuse me.
Regent Dickinson, part of this goes to the state's testing plan and what we use in our state, and that's just not prevalent yet in our state. There are conversations that we need to move in that direction, but that is part of the issue in terms of what's prevalent in our state and then what the labs are set up and are able to do.
Yeah, and we've failed miserably as a state on that. So I appreciate that, Colleen. So thank you.
I apologize. I should have thought to have Tim Baszler standing by to answer that question, but it has come up because Schweitzer has also been talking a lot about expanding testing capacity. At the end of the day, our lab is serving as part of the state's testing network. And so our testing has to be in alignment with the state's testing plan. And that's just not where we're at as a state.
Yeah, some of the point of care high throughput type or point of care are not high throughput, Marty. And this is part of our problem. We need to be able to we're working toward 1,000 tests per day. And the point of care is a great tool or whatever in the arsenal, the medical arsenal. But what people don't tell you is the degree of specificity and sensitivity of some of those. So we are looking at them scientifically to see whether or not we can deploy them sooner as opposed to later.
And can you, Colleen or Daryl's, I guess this is kind of circling full circle back to Heather's comments, is what influence can the work that you're doing actually drive our state's somewhat, inability to get out of its own way as it pertains to testing for whatever reason? And I understand it's much more complicated than that, but we really, for one of the most innovative states in the country, with access to things that are kind of insane, and a medical school on the other side of the state that received $50 million to get this thing, this testing thing handled. What can we do? How are we at WSU, how do we elevate your voice or the work that you're doing to help influence and drive our state to be better?
I think it's very similar to any initiative that we've worked on. It's got to be stakeholder based. I think that having the Schweitzer participate in our daily calls, and actually Whitman County Public Health, they do a weekly call, which is broad for business. It's very similar, Marty, to what you see with Alicia doing with GSI in Spokane. And actually it's very similar to Challenge Seattle. We kind of have a few models that have popped up around the state. My observation in our state is that we are very much a stakeholder driven state. And so if there is a commonality of issues, especially from the business community, as we're talking about talking about economic crisis, right? In addition to public health crisis, I think that is where we start to move that needle. But I do think that we all have to come together and bring that forward and ask for testing that is less expensive and that is faster, that is significantly faster. I know that we still talk about the NP, the nasopharyngeal sampling method, and nobody wants to do that. I don't even think we should be talking about that anymore. We should be well beyond that.
And Marty, what I would say is your question is perfect, but it's what we see unveiling. The state is asking for us to speak into what they should be doing, and Colleen's been very involved in this. So I think we are being asked to step up more, and we appreciate it. The regional health districts are asking for us to lead more instead of partnering. They want kind of a little bit more of a leadership voice from us, and so we're finding that space, and we do need to influence the state, I would say, more.
Yeah, I don't feel that. It feels slow. It feels super collaborative. It doesn't feel aggressive and assertive about here's what we need to do and we're going to go do it with or without you. And I know there's a limit to what you can do in terms of the with or without you part, but we've got a lot of capability just ourselves, and we have, to some degree, a captive population like an employer does, because A, we are a big employer, but B, we have all these students. So I feel like it's been 7 months into the crisis, and we could be leading already as opposed to being late to be asked to be leading.
I appreciate what you're saying very much, Heather. And I think that there is a perception, and this goes back to what Phil was talking about. I think we have an awful lot more to offer, and we need to step more deeply into the leadership space. So I hear what you're saying, and we're taking it seriously.
This may be a question for Mary Jo. Sorry, I've got so many questions, but why don't we require students when they enroll or show up for classes? Why isn't it online, obviously? Why isn't it a requirement that they be tested? Why is all this so voluntary sounding like, oh, you can do it if you want to, and we're gonna beg and plead and hand out candy? I mean, what's the prohibition on us just saying, if you want to go to school here, whether it's online or on campus, we need to have you part of our testing program?
Well, and I think it's interesting to go back to the UW announcement, what is having the same problem we are. It's voluntary. And there are some limitations around mandating a test for which does not prevent that individual from being sick. Now, we have had some conversation, and we absolutely believe that when you're going to use university property and when you're going to live on our facilities, that you need to prove and document the test. The question is about delivery, Heather and Regent Redmond. And I think that's something that we are working through. It's difficult, and it is not as simple as when you look at students for whom the healthcare system, there's always been a disparate impact on our multicultural students, on our international students, our DACA students, for whom the federal government has not had very supportive policies recently. And so there's a lot of resistance from communities that have not been treated equitably from the healthcare system to mandate a test. So there's a lot of complexities that we're working through. I do believe we will have a very specific structure for the spring. It's also why we made the decision in the fall to reduce occupancy, because we knew at that point we weren't ready or prepared to deliver those. And Colleen and Daryl and Kirk are all right. We are seeing what happens when you mandate tests, like at the University of Illinois, Florida State, that it hasn't necessarily stopped the cases or the increases of those cases on those campuses. So I believe, Colleen, if you could recall the name of Dr. Hofer yesterday on the phone call said testing is a solution, but behavioral change is the thing that actually needs to happen. Kathy Lofer, Dr. Lofer, am I remembering that correctly? I'm sorry, Colleen, that I botched the name.
Medical officer. Kathy Lofi, Dr. Lofi's.
So she even indicated from a state perspective that the number one thing we need to be focusing on is behavioral change, because that will make the most difference.
Absolutely, absolutely. So just to clarify, so what you are saying is that we could, if we decided to, we could require every student, whether they're attending remotely or on campus, to be tested but we've decided not to because we don't, for a bunch of different reasons for now. Is that correct?
I mean, I would just throw in here, and Mary Jo, please add or correct if I'm wrong about this, but we this fall have a majority remote instruction. So a lot of the schools that you're seeing that are requiring tests, that is because they are face-to-face. My son goes to a school that is primarily face-to-face, and they're required to get a test before they even showed up at the gates of campus. And on their own dime, by the way, which was not covered by insurance because it was asymptomatic testing. It cost us about $200. So that can be prohibitive for some families. But we decided to go primarily remote. Daryl could talk about the fact that a lot of the health science students actually are getting tested because they're required to for their clinical placements. But our goal is to move towards a compulsory testing for the spring semester so that we can start to open up our doors a bit more and combine that with the kinds of behavioral changes that Mary Jo is talking about, which are an important companion to the testing strategy. So we're moving towards that for spring because our goal is, as I say, try to move further out of this remote existence that we're all trapped in.
And the piece that I would, Heather, that we need to really address, or Regent Redmond, is we really need to address is that off-campus behavior is what's driving and we're going to talk about that in just a minute. If we want to transition to that, we can. But the off-campus behavior is driving that. And students wouldn't necessarily need to come to campus if we are online and they're engaging in their social environment. So mandating testing for them, there is very little incentive or compliance that we can implement to make that happen. And so I want to make sure people understand that there is a variety of complex scenarios that frankly, we haven't done a good job explaining. And I think we need to own that institutionally. Absolutely.
I would say to all of our regents, as we put together our plans for spring, we won't be sharing them with you in February. We'll be sharing with those in advance so that we can make sure that we're answering questions and dealing with some of the legal issues and some of those things out there that also have sort of gotten in the way at times of what we might want to do. And like I said, we're going to pivot and learn. We had a lot of students show up, and the behavioral stuff that Mary Jo will talk about, it's actually fantastic in Pullman from an economic point of view to have a bunch of these students back. The challenge has been the COVID-19 things. And so we know we'd be foolish not to anticipate in the spring that we're going to have a same set of issues when people may elect to be out of the community for a couple of weeks and then come back, even if we're on remote classes. So we've just got to look at other ways of doing things than we did this fall, and we're going to learn from that. So we'll, again, I don't want to always say be back in touch, but we're going to have a pretty thorough plan developed for what we're going to do spring semester. By the November meeting, we're going to be ready to lay that out in some detail.
But for the rest of this term, it sounds like we are staying the course. We're not going to change anything. We are, this is the COVID plan until the spring.
Yes. In terms of our testing, we made it free. We're encouraging our students that are off campus here, those kind of things. So yes, we are well underway with what we have. Now, where we have switched up is around enforcement and messaging and things like that weren't working from our beginning, and we've had to modify and change as we go through. So in terms of our testing protocols, yes, what we're doing now, I think, is there. And I apologize, Daryl and Colleen, if I'm misspeaking, but I think I don't anticipate big deviation from what we're doing now. Now, the change could be can we afford to continue to do free testing for the remainder of the semester at $100 a test? We probably can't afford to do what we're doing now, but we felt we needed to do that. Those are some things that I think could change based on where things are.
Let me identify one small thing, which is not a change. It's just an add, is the frequency of testing. So right now, we're just encouraging everyone, right? As many students as possible, come in and get tested, come in and get tested. And then once we have employees or anyone, right, which could be a visiting scholar, come in and get tested starting next week. The question is going to be, when do people retest? And so the modeling subcommittee is looking at that, and there will be messaging then that comes out and says, if you got tested, 2 weeks ago, 3 weeks ago, whatever the model predicts, then to encourage them to come back. So it is more than getting tested one time. It will be looking at the population that we have. We're very lucky because SCL is able to help us share information back and forth across the border. So we can look at the population broadly and then make a model, develop a model that enables us to target that and then have testing at a certain timeline. And that will help inform what we do in the spring.
Yeah, and Heather, also, just to be clear, so we're trying to roll out the staff and faculty testing. Teresa and her team have worked tirelessly on this one to try to deal with all the very important details. Further, there are certain student populations right now that even though we still use the terminology voluntary, they actually have to be tested to, for example, be in the clinical environments. Yeah. So what we've decided as an institution is for this semester, we'll absorb the cost of those tests. And sometimes the frequency is very high, for example, in nursing or in pharmacy or in medicine. And the vet med students are in a clinical environment too. So we are continuing to build that out. So we're not going to be static through the whole semester, and we're trying to learn from those experiences so that we can apply them to what we hope would be a compulsory program for the institution in the spring.
Thank you.
Kirk or Mary Jo, and when we've been hearing about the off-campus issues, often what we're hearing is that a lot of it's coming from the Greek community. Have you been working with either the governance of the various chapters on campus or the nationals to try to get some of that under control?
Yeah, Regent Powell, that has been probably the first thing that we did. We actually started before the semester began. In the summertime, we began meeting with our IFC and Panhellenic leadership, as well as our alumni. Kirk and I had actually a meeting with the alumni to discuss these very important issues, and our staff have been engaging with nationals. What we do appreciate, and you all need to know this, our students have stepped up to hold each other accountable so the Greek Standards Board, which is responsible for what we call lower level violations, and that we want to manage that within, they automatically took 8 chapters through the Greek standards process, put them on probation, and did a lot of, by the way, we were supporting them through this entire process, that they needed to demonstrate that these behaviors were effective. What we saw based on those initial parties is that it has declined. What Chief, and I was going to share this later, what Chief Jenkins shared with us is that it clearly was a pattern where there were a few groups that were doing this in violation of the rules. We addressed those, but then it started moving into what you all know is the houses that exist off campus where individuals live. And so he's been much more aggressive, went from an educational campaign to a house citing the individuals who are residents of that house, meaning who have the contract. And now he has moved to individual citing given the city of Pullman support. So that aggressiveness, I think, and assertiveness that we've done with the Greek community is exactly, frankly, what the UW and institution across the country have. We have been a little bit more lucky because we do have those individual relationships with our Greek community and the Greek leadership of that.
But how about the non-Greek community? has that been ramping down, or is it still a major issue?
So the majority of the testing results, and Jason was going to be, I have someone who can share some of that.
If you're going to share that, I'll just hold my question.
Perfect. But yeah, that's definitely one of the questions we knew we had to understand the data that was coming at us.
So any other comments on testing? And if none, Vice President Gonzalez, did you have more on student affairs to present?
Absolutely. We've got, yep, I do want to start off with Regent Redmond. I want to thank you for bringing out the mental health issues related to students. I would normally provide that update in my student affairs committee, and it seems like I probably need to be sending you some updates as a regent, a board of regents, so that you understand some of the efforts or the initiatives that we're facing. Guy, would you mind putting our slide up? There's a reason why I want to spend a few minutes talking about the Cougs Cancel COVID campaign. It's because we knew that we were going to be experiencing mental health issues with our students, connected, specifically related to connectedness and belongingness to WSU. And so we had heard by surveys, we had done focus groups this summer with our students, that they knew that they didn't know how to be engaged in a healthy and safe way. And so things like the fight song, frankly, that have value and meaning to us. Many of our first year students were able to learn that. They missed out on the opportunities to do much of what we would have them do in our week of welcome, where they are learning about all the traditions and the rituals. And so that is why we created the Cougs Cancel COVID campaign. Want to remind you that it's a science-based and research informed public health effort that has 5 prongs. The first prong is designed to approach how students can live in the COVID environment. And so it's not just the amazing signs like the one behind me, it really is a philosophy, and it's how to live in the COVID environment. How do you create relationships in a COVID environment? How do you get together in a socially distanced or a physically distanced way, but can socially connect? Were really critical pieces of this. You'll also know that we did the harm reduction campaign, and the governor was very pleased with those efforts. And again, students had direct feedback and direct guidance in terms of what the messages were. So they aren't designed for individuals like me or President Schultz. They really are designed for students. And it resonates with what they have and what they need in terms of that. We also had a behavioral intervention process, which is what to expect when students are coming to class, what to expect in a virtual environment when engaging with our faculty and staff. We have students who are employed in the university recreation area who frankly are already focused on health behaviors, who we've hired to be our Cougs Cancel COVID champions and are finding and catching students who are doing great things, doing some peer-to-peer presentations, but also again, trying to manage and change the behavior that is going on in our campus area. There's also club quarantine. And I need to share with you, Regent Redmond, this is where we are most concerned. We heard from students that being quarantined or isolated is probably the hardest thing that they have ever had to do. And so what we've done is created a circle of support, a connection, and we are even we'll be handing out starting next week, these bags and gifts so that they have snacks and they're reminded that the Coug community cares for them. But this is one of the areas that we are seeing significant areas of concern about how do you isolate and quarantine at a time when you really are looking for significant connections in your college career. I think the last thing that's really important to know about this campaign is we are focusing on education in the community standards process. Students developed a video, and the video is to talk to their peers about the impact of their behavior on others. And so one of the sanctions that students have to do is they have to write about what they're going to do to change their behavior and who they are doing it for, because it's got to be personal for a lot of these students, and that's how we need to change that behavior. We know that shame, blame, and discipline as a first step does not work, which is why we have taken this approach. We've also partnered with our public health, law enforcement, and landlords. We have been meeting regularly. I'm really thankful for our Dean of Students, Jill Creighton, who's leading that, connecting with them on a bi-weekly or probably every 2 or 3 week basis. So we are communicating about what's happening off campus. There are also many of the chapters are managed by some of the landlords. And so we're able to get direct information into some of those Greek facilities. In terms of where we are going and moving forward, I think it's important to note, Gary Jenkins shared some data. He's our chief of police here in Pullman. And he shared some data that they had released and had issued 10 citations at 8 different parties during the week of August 27th to the 30th. That has declined for the week of September 10th through the 13th to 4 infractions at 4 parties. So they are significantly declining as we move forward. And again, that's lower and lower numbers. I would want to introduce to you someone who's really important and a phenomenal partner. He sends emails as late as I do and as early as I do. His official title is Assistant Director of Public Health, Environmental Services, and Sustainability, but our title and my title for him is Super Coog. He is the one who helps me translate the data, and we wanted to share some of the pressing questions that we've been asking ourselves. And it's those things like, how do we provide insight as leaders to make really good decisions about students who are testing positive? What are the best strategies and approaches? What does the positivity rate really mean, and why it is important to focus on those individuals who've recovered and what that rate is? What directions are the trends going, and is it the right direction? And most importantly, is what we're doing actually working? And so I'd like to give Jason Sampson an opportunity to talk with you about some of those fundamental questions that have come up. Jason?
Thank you, Vice President Gonzalez. So we've been actually kind of watching the trends all summer, but obviously the big uptick in cases that started right before class started on August 24th kind of drove us to actually start to have tracking the statistics a little bit better. So we work with the county, as Vice President Kerr mentioned earlier, on every morning to kind of get the stats in line and work with the contact tracing teams to actually make sure we get that data by the end of the night to share with the administration so we can actually kind of help with those decisions. Obviously, I think everybody was a little bit shocked with how quickly the cases jumped from 1 or 2 a day to 30s and 40s, and we've been kind of holding at that number, except for the weekends. It should be known the weekends, it's not because case count goes down. That's just a kind of a slow down process in lab processing and testing. And so we'd rather just take the weekly average of about 30 or 40 cases a day, because that's actually probably a better number than actually seeing 7 or 8 on that Sunday and Monday. It kind of just averages out. What we are seeing actually on the trends is we saw a peak about 3 weeks into class schedule. So that's actually just before Labor Day. And actually we're now starting to see that drop. So we went to about 250 cases over the week, that first week of class. That peaked at about 354. And now we're actually dropping back to that first week about 240. Obviously with the smoke, we're kind of waiting another week to make sure that that smoke that we've had didn't minimize the amount of testing. And that actually is truly the trend. But with the testing going up again later this week, we're still seeing a little bit lower case count. Obviously, as you guys are all concerned, it's been in the news and all across the nation, we're seeing it in the Greek life. You're seeing that a lot of cases early. So on those first few weeks, what we saw is about 70 to 80% directly associated with fraternities and sororities. Most of them were not live-ins. They were in those 11-person apartments. And then everybody in those apartments were getting positive. So a lot of that case count is not 11 separate apartments. That's actually one apartment with 11 cases, or a fraternity with 16 to 20. So it's something that is very important to note, that the inability for students to be able to isolate in those apartments was very complicated. And so we worked to actually try to find alternative location for isolation, because for community transmission, it's important to pull those isolations out. And so we worked with the county to identify some locations for those particular individuals. We have not seen that same kind of situation in the dorms, because we de-densified the dorms because of we went to online, and so we've been able to isolate them a lot quicker. So we haven't seen that case count in the dormitories. So what we've been looking at over the last 2 weeks is, are we actually transmitting from Greeks to actually what we say is the others, or the students that not are associated with Greek life? And so what we've noticed, we're holding at about a 50-50 split. So obviously Greek life are allowed to have friends that are not associated with theirs, or fraternities and sororities. And so some of those have roommates that are just not in Greek life. And so we're still finding a lot of that same transmission is happening from original fraternities and sororities. So we're still seeing that 50 to 60%, and we're hoping that trend holds. With the contact tracing, it's really something important to note, is that we're not seeing any of the cases transmitting on campus where we have our return to work plans in place. We have not seen that student employee transmitting to employees or other students in the workplace. We have not seen that in the College of Vet Med, where they've had 450 students here for the last 6 weeks. It's really on the socializing off campus. So it's good to know that the return to work process and planning has worked. Another thing that we want to be open on.
Jason, I'm sorry to interrupt you, Jason. This is Regent Dickinson. A question that I do have that we haven't heard anything about is we're hearing about the number of cases. What is the impact to Pullman Hospital, and how many hospitalizations do we have at this time? And have we had any deaths occur in Whitman County at this time during this period of time in which we've seen the cases spike?
Great question. So we have been very fortunate in Whitman County, and that as of this morning, is my understanding, we've had 3 hospitalizations in total. 2 of those were before this all started. One was right at the very beginning around April and May. We had a second one around June and July. And then this morning, we actually had another one that was actually from a long-term healthcare facility. They've tested every patient using the rapid testing that we do have available for those situations at the hospital, and no other resident has come up positive. And it should be known that this person actually tested positive now about, I believe, 7 to 10 days ago. And so no other employees tested positive, and it was the one patient. That patient was hospitalized, unfortunately. They're holding steady, but unfortunately, as we know in long-term care, we don't know the outcome. And so far, we have had no fatalities in Whitman County.
So if I'm hearing you correctly, of all these students that have tested positive, we have not had students hospitalized. Is that an accurate statement?
Yeah, we've had 0 hospitalizations from students.
So, Kirk, Mary Jo, Phil, I think these are important things that we need to have a drumbeat on, because we often miss the point. I mean, there could be something actually really positive happening here with hundreds of people getting COVID at Washington State University and being asymptomatic, and what that looks like long-term for our campus. I know that's not the headline, but the headline needs to be, we continue to, not be at this point in time, thank goodness, not seeing hospitalizations, and we have capacity to manage the situation.
Thank you. Appreciate those comments. The other thing, and just 2 other things I'd like to point out, is we're actually down to 17% of active cases. So we may have had close to 900 cases at WSU, but only 17% of those cases are actually considered to still be active, meaning the individual that tested positive is still in that isolation phase. The rest have actually progressed and are kind of back to their daily lives. So that is a good one. And the one comment I do want to kind of compare is University of Idaho. There's been a lot of comparisons between us and University of Idaho. And why do we have these big numbers at the beginning and University of Idaho did not have those? And just one of the metrics that the state of Idaho decided versus the state of Washington is when they actually do their case stats, those first 2 weeks, you have to be a resident for at least 2 weeks before that case counts to that county. And that is across the entire state. So the initial test that took place at U of Idaho went back to their permanent residents for that 2 weeks. And now we're actually transitioning to them being counted in those counties. So you're not seeing the spikes in state of Idaho like you do in other states where we have universities such as Pocatello, Moscow, and Boise. So that is just a decision they made long before the students came back. That wasn't just for a PR move, but the state of Idaho had just made that decision. So yes, we have more cases in University of Idaho. I don't want to make that as the point, but it's just the way that we actually want to make sure people understand the metrics.
Would it be easy to give us this data? Like I see the data for King County every day easily, but I feel like for Pullman, I'm always like trying to do Google searches and I don't really know how to get the information readily, and it's not always covered in the press. But I would love to know, not necessarily on a daily basis, but on a weekly basis, how we're trending on things like infection rates, per tests, number of tests, and then obviously hospitalizations and hopefully none. But if there are deaths, obviously we should be tracking that as well. I think that would be good to be readily accessible to the Regents through a portal or something, if that's possible.
Regent Redmond, we are working on that for you. We actually met this week and Jason expanded some of the data sets that we had, including the recovery rate. I think the active cases, most people don't realize that's a very small number. It's about 200, Jason, or less than 200 at this point that are actively in infection. So for me, I think we can get that to you relatively easily given some of the data points we have.
And one, opportunity, I guess here, it's an opportunity born of tragedy, but do we have faculty that are taking advantage of the fact that we've got this population now of young people who have had COVID and enrolling them in some long-term study?
I'm going to leave that to Daryl and Colleen. I do know that we would have to go through a thorough institutional review board for human subjects. So Daryl and Colleen, do you want to answer that question?
So we're using the anonymized data, Heather, but we haven't enrolled them in a study. So they are looking at this with a scientific modeling eye. So the answer is yes, but not quite the way you said.
Yeah, and once we define the parameters of our plan, right now it's just test everybody, but once we define the parameters of our plan, we can write a proposal to NIH and actually then report on it and have it as a published study. So that is one of the goals that's out there.
Anything else, Jason, or is that your report?
One more stat that we want to throw out is we just ran the stats this morning. And the big New York Times article that kind of got us on the map, unfortunately, was the positivity test rate. And as of this morning, we're underneath 20% finally. We had reached almost to the upper 20s as the number of positive tests. So that was about around 30%. And as of this morning, as of weeks total, we were at 19% positivity. So we are trending in the better direction in that stat as well.
Guy, if you can take on the slide, Regent Blankenship, I just have one closing comment that please let us know if there are particular data needs that you have or interests. I know that I've received a few emails, but that we can easily answer those questions and get them to you in a space where I will work on getting you some updates around student affairs and what we're doing in terms of those stressors that we're seeing students encounter.
I do Friday update on COVID-19 stuff to the regents. And what I would plan on doing is just simply dropping some of this data in that particular update every Friday. So it's kind of a week tally with some historical trends so that everybody can kind of see where we are. Jason has a spreadsheet that internally we have access to so we can map out those trends. And so what I'll do is probably not tomorrow, but the next week we'll have all that stuff. And I will shoot out tomorrow something with the data in it, even with us meeting tomorrow so everybody sees it. And then what I'll need you all as regents to do, if there's other things you'd like to see, just shoot it back and say, what about including this or that? And that's actually really easy for us to do. So
I think what we're looking for is overall trends. So rather than raw numbers, show us a graph from the beginning to where we are now and just keep that updated.
Yep. And Heather, interestingly, Jason does a great job of giving us daily updates. But recently, what I, because I'm a data guy, started talking about we need to look at week by week things and trends and stuff like that. Because if you get excited by the daily numbers, good or bad, it's not, we have 60 one day and everybody's panicked. You have 2 the next. And Jason would say, hey, that's just, you average it out. And that's really the important thing to look at because maybe there was a blip in number of students that got tested. So I want us to be reporting more as we talk in the community about weekly trends and some of these other things and not just get excited, good or bad, about a daily number because that's not the right way to approach it.
Agreed.
So, anyway.
And that seems to be the way other people are reporting as well, for the counties and whatnot. So I think that's a great way to go.
I would say the last thing, and Jason, I appreciate you sharing all this, and Mary Jo, the good news, the really good news is the trends are moving in the right direction. And I don't mean that we're somehow magically it's all fixed, but it's the trends are moving pretty consistently in the direction we need to. I think the enhanced testing, the work Mary Jo and her team has done, the COVID's canceled 19, the work with the Pullman police, it's, you know, kind of all cumulatively helping us. We still got a ways to go. And then the other thing I want to continue to remind everybody, I do this in the community, you know, as that trend continues and as we get down to numbers that we feel really comfortable with, we can't stop because we got a whole semester and a whole academic year. And all it takes is people wanting to get those numbers down and then a big ass party somewhere over the weekend, and we can see that stuff spike back up again. So we just got to be diligent in our communications and things like that all through the semester.
You know, I think that's a really good point. The other concern that I have is beyond the statistics is the human impact side. So the idea of how we're storytelling, what's going on, you know, frankly, it's really unfortunate that we've made the headlines in the way in which we have. And with that data point in contrast with, you know, the data that's coming in, there's a loss of what the story is, what the, you know, I love Heather's question that she usually asks, you know, what's the morale? Like I'm missing some of that other than this is kind of the campaign we're running. I want to better understand not only the student impact, the faculty and the staff impact, and be able to start to see a narrative that's playing out that perhaps we're directing externally in combat to some of these headlines that are just really unfortunate. Which goes back to the PR and ensuring that Phil has the resources to be able to do his job.
Regent Shower, thank you for saying that. We have a series of stories that we've collected from students who've been directly impacted by COVID-19, including the loss of a family member. And we have been talking with staff also who've been impacted. So I think you're absolutely correct about the need to actually communicate directly how our community has been impacted, but also how our community has supported them through that process. So that's a very good point.
Thank you all. Was there more, Mary Jo or Jason? No other comments? Well, we've been at it for an hour and a half. I'd like to take a 10-minute break, and we can resume our discussion with the next agenda item at, say, 9:40-ish. Thank you.
Do you need anything before I go?
I need a microphone that responds.
Play football?
Huh?
They don't play football?
No. I don't know about the spring. Well, I'm not even sure we know that yet.
Big Ten changed their mind.
They did? They're going back and playing?
Yep.
Oh. Don't forget you got berries in here.
Good.
unmute. Let me just tell them, go live.
Are we gold? Well, thank you, everyone. We can resume the meeting now. But before we go to the next agenda item from the Office of Research, I neglected to announce or welcome to the board our new student regent who's on the call. Hopefully you can see his picture. Arle Kayanen from attending the College of Pharmacy. So welcome to the board, Arle, and thank you for joining us.
Thank you.
And yes, you're getting a virtual clap as we speak. And we also have a new faculty representative at this time. Last year's chair of the Faculty Senate, Dr. Greg Crouch. I don't know if he's on. There he is. So welcome, Dr. Crouch.
Thank you.
And thank you for your voice at the table. So next on the agenda item is a report from Dr. Keene from the Office of Research. If you're ready, Dr. Keene, we are.
Great. Thank you, Regent Blankenship. Can you all hear me okay? Give a thumbs up on that? Okay, super. So thanks, everyone. Appreciate the opportunity to give you a brief update on what's going on with research today. Before I do that, I'd just like to acknowledge some of the folks on this call, especially that have been so helpful. As we've gotten into this, we really realized the strong number of interconnections required to make everything work here under COVID, especially, but particularly under research. So first of all, Regents and Kirk, obviously, thank you for your support. Provost Chilton, I work closely with Elizabeth on dealing with the faculty and the deans in this, so thank you for that. Vice President Pearson, Vice President Pearson's office owns environment, safety and health at WSU, along with research assurances in my office is the primary manpower we use to ensure compliance with the return to research plan, which I'm going to talk about in a few minutes. So Vice President Pearson, thank you for that. Vice President Kerr, thank you and your team on the federal relations side, obviously for funding and all the interactions with our sponsors, and on the state relations side for the approval process interaction with the Department of Health for everything associated with research. Couldn't do it without that. Mary Jo, your help in this too, navigating approval processes has really been appreciated. And finally, our chancellors, I'd like to point out too, as the landlords and owners of their campuses, we work closely with them, but they are responsible for safe implementation there of the policies we develop centrally in collaboration with others. So I just want to run through that because this is really a very highly interconnected operation to bring research back. I just want to make sure people understand that and thank everyone for their role. So with that, let me give you a quick update. Maybe Kyle, if you could put up the one slide. Yeah, okay, the next one, thank you. Okay, everyone, so this is basically a summary of what I showed last time, just providing as background. So we issued a plan on June 5th for a staged return to research. It was about 12 or 13 pages long, filled with, social distancing, other guidelines that you have to perform. The way this operates is essentially, as you may recall, we have treated COVID as something where, for example, in a laboratory or a shared research space, we've developed a safe operating procedure. In order to resume in a given facility or operational area, this plan had to be signed by the principal investigator. and also concurred on by their chair, right? And so pretty standard. But I'd like to emphasize the PI is responsible, and we check up on them. And so that's the underlying logic, very much a logic grounded in fundamental safety principles. Okay, so that's what's been set up. So how have we been doing on that? In terms of the level of research that's resumed, including folks working at home that are essentially 100% able to do their work, we estimate we're at about 60 to 80% overall, quote unquote, returned, which is great news. There are some variations in that though. For example, just as a quick stat, there's about a little less than 300 labs or shared research spaces in Connors, of which probably 90% plus have signed work plans up, and the others we're working on or else aren't doing lab work right now. Right now, one of our areas is in medical of concern is an area of medical education and clinical activities, where actually our return rate is probably only about 10%. And that's because this is close one-on-one human subject interaction, typically within less than 6 feet distance. So we're just working through how to return these activities and do risk assessment and provide some exception basis approvals for that kind of work. Okay, as you can imagine, that's sort of a special case. So we're working through that. But globally, 60-80% have returned, which is great. We're very pleased that, again, I mentioned this last year, you may have heard it also from Daryl, Colleen, and others. Dr. Roland Palmer have performed a critical role. Professors Guy Palmer and Vet Med and Professor John Roll, Vice Dean of Research at the Med School, have played a critical role in coordinating our faculty research activities. And there's a lot of innovation there, Heather, to your point. I'll talk about a couple of examples of that very briefly in a moment. So just a couple of quick stats. First of all, I think you may have heard this alluded to at the last meetings. I hope it did come true. We did have $1 billion last year and submitted proposals. So kudos to the faculty for that. Colleen and her group on the federal side for helping us get that submitted. That was really wonderful. It's only the second time we've done that. So the faculty have been just fantastic writing proposals. In terms of COVID related awards, we have about $60 million in proposals out there. We have about 20 out awards right now of about 30 million, which includes 22 million for the CARES Act, which isn't research. It's really student support. It does get counted as an award though. And we actually have quite a few pending. Actually, of the 60 out we've submitted, about 55 are awaiting decision. So a lot has been done. We're waiting to hear, but we have had some very nice wins. I think a couple I'd just like to point out that really leverage our current capabilities in vet med and infectious disease. Many of you know our work in Africa. In Kenya, we have about 150 people on the ground, including monitoring the health of 20,000 individuals in the Kibera slum in Nairobi. Amazing work, and I've had the privilege of seeing it, and I know Kirk and you and others are hopefully going to be able to go see that soon. We've got a supplement for CDC to that work, so we're now tracking COVID. We're now tracking COVID in that population. We also received a $7 million award to create an infectious disease center. And that was from NIH. Again, our vet med colleagues are critical for that. So again, our faculty is doing a great job there. So in any event, we're working through this. We've got a lot of individual highlights. Kirk, I already sent you an email. We can put together, Heather, your question, Regent Redmond's, your question, some highlights of what's going on here that's quite innovative. But I guess I'll just close by summarizing. We're returning to work safely at about the 60-80% level. And I'll just take questions from there. Thank you very much for the opportunity to give you a brief update.
Any questions for Dr. Keene?
Hey, Chris, this is Kirk. If you don't mind, talk about our performance as a system last year in terms of overall sponsored research.
Yeah, sure, Kirk. Thank you. Yeah, last year, being FY19, which is the latest year we have the data, we had a record research expenditures, again, about 370 million. We've been trending upwards every year in the range of 2 to 2.5%. I think that's especially noteworthy because if you look at our faculty numbers, as you heard from Vice President Pearson and others, we're down about 300 folks globally at WSU. That includes faculty. So in fact, our faculty has shrunk. And our expenditures number of 370 million roughly in FY19 divided by 900-ish faculty, tenure track, works out to about 400K per tenure track faculty member expenditures, which is at the top of our peer group that we use to measure ourselves against. I mean, for example, Purdue is at 275K, and et cetera, right? So once again, kudos to our faculty and staff who, despite shrinking numbers and the difficult conditions, continue to crank out record numbers of proposals and do very well receiving awards. So we're just very fortunate to have the dedicated faculty staff. And again, I'd like to thank many of those on this call that have helped make that all possible.
Any other
Chris,
comments? Yeah.
This is just Marty, Regent Dickinson. I just say thank you. It's really actually, it's great to hear something that's moving forward. And appreciate that you've been so intentional about getting it back on track. So thank you. Great report.
Thank you, Marty. And thanks to all of you, many of you in this call again. This is a huge team effort. It's definitely not just one office. It's a very extended effort to do this.
Yeah, thank you, Dr. Key. Okay, we're going to have a in-depth presentation on integrated financial forecast and planning from Stacy Pearson and her staff. So Matt, are you on as well? Very good. Stacy, take it away.
Yes, we're here. Well, thank you and good morning, everybody. As Chairman Blankenship mentioned, Matt Skinner will be joining me, and we would like to walk you through our integrated financial forecast and planning tools for fiscal year 21. Such a plan and forecast tool is important in any case, but obviously COVID-19 has really accelerated some of the things that we need to be working on. I'm going to share my slides here, and if I have problems, then I think Kyle's going to help me. So we'll get started on that. And then also I would mention that you do have some details in the agenda. It's information item number 3, I believe, and there's some details there. But meanwhile, I'll walk you through this. Today, what I really want to cover is a short review of the successful results of our fiscal recovery plan. Thank goodness that we were able to do that. And then introduction into this financial forecasting and planning, what we're doing currently in fiscal year 21 based on the results and some of the things that we've already put forward, and then identify some additional financial strategies and tools. So to the fiscal recovery, and I know that some of our regions are newer, and so what this slide is showing is that if we go back to fiscal year 13, we had some pretty positive balances in our operating budget. And this black line here is our university reserve balance, and making some pretty significant investments in medical school, athletics facilities, veterinary medicine, and maybe some residual results from the previous recession. We really saw our operating expenditures each year go into deficit. Clear through fiscal year 17, where we had about a $30 million per year operating deficit. So we implemented a plan, a 3-year recovery plan, and it literally was the intention was to reduce that deficit by 10 million per year to get to a break-even balance. As you can see from this graphic, the shaded lines here is each year we were able to really exceed those expectations. And the people to thank really are all of the faculty and staff who just simply, we gave them the tools, we gave them their balances, we gave them their targets, we measured their spending each year, but they did the work to be able to end this so that we had about a $28 million surplus ending in fiscal year 20. So that is certainly successful. The thing that, while I'm very pleased about this, it's this black line then that is still keeping me awake at night because I need this to go back up. the numbers are over here for that black line. So you can see that we were over 200 million in having a reserve balance. And this means we're about at 120 million. So that certainly is good progress. But just for reference purposes, that is about 2 months of payroll, WSU. And so that's why I want this number to get back up into those more positive categories, is because we need that cushion. And certainly with COVID, that is also important. New revenue has been the primary driver of this. You'll know that we've gotten support for the medical school. We've had some modest tuition increases and enrollment growth in that time period. And then also we've had a lot of growth in our summer sessions and online MBAs, professional programs, and things like that. This is a base cash forecast that we have run to help us look at this. And I know it looks pretty alarming as it goes up and down, but I'll just give you the perspective here. Here's our fall tuition collection. Here's our spring tuition collection and summer. So that is why it jags like that. But if you start in 2017, you can see the progress that we have made on our cash results. And if we were to continue as we had in these previous years, here we are today, then we would expect that to continue. And that would help me deal with that black line on the reserve. So that is that is really what we were planning on. So integrated financial planning and forecasting is really essential for any fiscal challenges, but brought on by COVID-19, this has become even more critical. And really what I'm talking about is there is a tendency at many universities, and certainly at WSU, is that they focus on certain types of revenues, say our state appropriations and our tuitions. Well, integrated financial planning is to say all of these things are included. And that we include those as we look at our forecasts and we measure our cash balances. And again, very important in this year of COVID and the next few years, certainly. So we look at the major changes in the academic affairs budget and planning, our auxiliaries and enterprises. So that includes our housing and dining, our student auxiliaries, parking services, athletics is in there. Look at our state appropriations, our net operating tuition, that being our tuition revenue less the waivers that we would fund from that revenue, our F&A cost recoveries from grants. Again, enrollment, financial aid and waiver planning is very important. Intercollegiate athletics plays a major role in this, as does sponsored research, which Chris just reported on. And then salary planning, capital investments, and then of course our fundraising and advancement activities. So we really develop those tools develop our tools around all of those areas. So the COVID-19 pandemic is certainly bringing some big changes, certainly across the nation and the world. You probably see an article on higher education every day, not just on COVID cases, but the impacts that it is having. Obviously, states are experiencing revenue reductions, and so that is passed on to state agencies. And it was announced earlier from the Office of Financial Management that they're expecting agencies to take a reduction in the current fiscal year. Ours is in the amount of about 37.2 million in that amount. So for WSU, our current forecast suggests about a $54.4 million revenue loss for fiscal year 21. And that's a net. So that is after the revenue losses and then the expenditure reductions that we've implemented. And so this is the net amount. That's slightly reduced from the announcement from athletics last week on their additional cuts. So it's probably around 53 million, but I just expect this number to adjust as we go through the year. So that is a reason we are actively developing these tools to help look at this. This gives you an indication from that cash flow chart that I showed you recently that, instead of having, if we continued on the trend that we were, that what we're seeing with this current year, if we modeled that out to future years, is that cash. And so then that gets to that low amount in a few years if we don't take action.
Stacy, this
Yes.
is Regent Dickinson. With that net figure, could you just clarify for the benefit of the board that 54 million of that also incorporates 30 million of the athletic budget loss, as well as it does assume that we will play football in this academic year. Is that's accurate?
That is
right?
correct. So it's based on our latest available athletics budget, which is projecting a $30 million deficit, again, slightly less from the announcement that was made. And we will certainly update that information for you at the November meeting. But yes, that net is the approximately 30 million athletics. Another is in our housing, dining, and student auxiliaries. Those are the highest, the greatest amounts. I think those represent about over 60% of that amount of the loss. You might remember in June that I gave you kind of some forecasts. We were doing a best, medium, worst case. We're actually, when it comes to tuition, we're hovering around that number that we were expecting about, or modeling about, a $6 million loss in net tuition revenue in June. And we're keeping that there for where we are right now. Again, we still have spring term to go. So in other words, it's where we are now with the tuition revenue is kind of based on the model that we presented to you in June. So we've been able to, we did a pretty rigorous budget process, budget hearings. We passed that state appropriation reduction. We went all the colleges, campuses, we came together in June for a 3-day process where basically we gave them a 10% reduction. So that state appropriations reduction is pretty much handled through those reductions that we did on campus. And then that additional dip from projected tuition revenue losses is managed through some of the savings that the university had centrally. I'll give you an example of that. Is we had set aside some money to hopefully do a small salary increase for faculty and staff mid-year, but we were not able to do that because of this situation. So here are some of the things that we're working on currently. Obviously, additional state and federal emergency funds. And as you can imagine, we understand that those are targeted to COVID-related expenses. So what kept us in really good shape for fiscal year 20 was the fact that we received that CARES money that helped us cover those housing and dining refunds that we gave. That was approximately 21 million. Half of that was direct emergency aid to students, and the other half helped us deal with that, as well as covered the cost of Chromebooks and internet access and those types of things when we went to remote learning back in March. So what we're hoping is for more of those funds, particularly as it comes to help us to support the cost of testing. We do have some funds from the state that will help us in that regard, as well as a small amount of FEMA funds, but our Colleen's group and others were just working to identify other opportunities there. And of course, we're paying close attention to how we account for those funds so that we can report those appropriately. During our fiscal recovery, we had restrictions on the use of carry forward funds and reserves. What that means is every area budget, if they don't spend all of their money, if they have vacant positions or what have you, they have carry forward funds. And so what we did during the recovery was just not allow the use of those funds. That helps with that reserve line to build up that reserve. So not only did they have to restrict their spending, but not use their carry forwards. And the hope was after the recovery is that we could release the use of some of those funds for good reason, because those are funds that we use to invest in new programs so that we can generate additional revenues. We're going to have to continue in this year to restrict the use of those funds as we go forward, so that we can maintain those cash balances. Additional cost savings and restructuring. So as I said, the university went through all areas through a 10% reduction exercise, and it's been made clear that we did that for fiscal year 21, but we understand that many of these reductions are going to have to be permanent going into the next biennium, because the indication from the state is that this is projected to be about 3 years. We haven't gotten any updates since the summer, but that's kind of what we're basing our plans on, is that this continues. So as we go into our next budget exercise with the campus, it will be with having in mind what it is we have to do for the next 2 years. And the reason that is important is a lot of these cost savings for the current year are achieved because you delay filling positions. Well, that's not always strategic, because what if it's all chemistry professors that are in those vacancies? Obviously, we have to, it might work for you might be able to delay that hire for 1 year, but what we're talking to the campus about is you may have to do restructuring, and, as we think for those future fiscal years, because you probably can't just keep those particular positions vacant for the next 3 years. So we're going to have some, rigorous budgeting activities over the next couple of years. Revenue generating programs and activities. We have had a lot of success with our professional online programs, professional programs, and we are encouraging colleges to identify more of those and to need to make some investment into moving those programs or in reallocating from other programs. Some of the things I want to talk about are these these next 2 lines. The market rates are very good when it comes to debt refunding. The rates are even lower than they were before. And so we have some opportunities here to just simply refund our debt, or as I say, refinance our mortgage, so that we can bring those savings in, because one of the goals for this year is we've got to bring some cash in. It will be held centrally just to help us with that cash flow issue that I showed you before. And then we're also looking at restructuring our existing debt or new financing options to address that cash liquidity. But we have to look at that very carefully, because as you know, going into debt to address this just means that then we have larger payments in the future. So the 2 restrictions we've put on our analysis right now is, what can we do that won't increase our annual debt service payment and won't extend our debt repayment out longer than it currently is? So that's what we've been working with our financial advisors at PFM about, looking at that. And then obviously unrestricted contributions to support the operating budget, meaning able to take those funds that are raised to help support colleges and activities, so that we can bring those into our operating budget, both this year and certainly in the next couple of years.
I have a question just around the philosophy. I love that we're holding the line at, we will not increase our overall debt service burden or the tenor of our debt. But, in sort of, and I know we're not corporate America, but, there's a phrase of never waste a good crisis. And I know that universities are very slow to change, and it's very hard to restructure things. And sort of the writers, and analysts are kind of ubiquitously saying at this point, universities need to recognize that they are entering an entirely new world, and that COVID is accelerating that change. So I like the general idea of, being positioned to grow, thrive, et cetera, post this crisis. But I wonder if we are, because of the just amazing work you've all done in getting our fiscal house more in order, if we're not taking some of the more radical moves that we need to make to remake ourselves for the next, couple of cycles of change here, because we have this maneuverability that you've achieved by doing this pretty radical recovery program over the last 3 years. So I just want to put that on the table, that I feel like we're perhaps missing an opportunity to do more and maybe stop doing some things and start doing some things. And we're still doing that kind of approach of, it feels to me to be kind of the pancake solution of everybody has to feel some pain, but not really looking at where do we want to invest versus where do we want to uninvest.
Yes, and that obviously is something that we were planning on as after the recovery, even before COVID hit, but it becomes even more important now. And so that is the key, is how do we structure this so that we have both resources to, kind of shore up our reserves during this time period, but also to think about the future. And so we can't achieve this entirely through budget reductions, but we also can't achieve it without doing some spending reductions. And so I think that this year, one thing I would say to that, Regent Redmond, is, this did happen pretty quickly. And so the plans that we were having to say, hey, as we come out of this and we make some strategic investments, now is the time to look at how we might look at some of those programs that are either of lower productivity or whatever, and be able to also look at how we can reallocate. I think that's part of something that we were going to put into our new budget model process, which the new budget model was to follow the recovery. And then Dr. Chilton and I will co-chair an executive budget committee that will, in fact, take a look at the very things that you just mentioned, as well as to what is the best budget model going forward. We need to modernize our budget model. As you just noted, it's been somewhat incremental in nature. We go up together, we go down together, and over the long term, that isn't strategic, but certainly getting through the current year. And even with that, we did make some adjustments within that more or less, across the board reduction, as we had to look at some of the areas, especially as it related to being able to support students and make sure that they got the coursework that they need and that type of thing. So we take to heart what you're saying and understand that this has to be more strategic.
So Stacy, I know we'll kind of get into this. I just need to, I get probably a benefit of spending a lot of time or more time with Stacy than some of the other regents do on various things. And it can't go without saying that you're pretty much a rock star when it comes to, helping and guiding this entire process with a very steady hand. And it's not an easy job. And it's probably a very thankless one. So I just really acknowledge the work you do. I acknowledge the work Matt does and your whole team. So thank you, thank you. I think, one thing that as we begin this discussion and as we have this discussion over the next several hours, I struggle with the elephant that is sitting on the financials, because if you were to peel away and really truly separate the athletic side of things, the number that you're looking at on the kind of operational, academic side of things, it's a big number, but we can do that's a manageable number, and it's largely manageable because of the amazing work that everybody has done for the last several years. I can't actually imagine where the kind of conversation we'd be having right now would be very different had that work not happened. But how do you, I do think that we have to somehow, and the Board of Regents has got to lean in and really have a very difficult, clear conversation. And I know we have the athletic budget approval process later on the agenda, but I don't believe you can do that independently. I think we got to have this whole conversation because it all becomes one.
Right.
So if you can kind of walk us through how you separate those things out a little bit, number one, and number two, also, help me understand, and I know there are many limitations, and I don't pretend to know this, but we have reserve funding at Washington State University at this time. Have you dipped into those reserves to get that number to approximately 54 million already? Or have we touched the reserves of these various colleges, of which I understand is coveted, but how does that work? Because when you're needing to refinance debt and you need cash, yet you have a reserve fund, how does that work?
Yes, and so what we did, that's a very good question, because like I said, for the past 3 years, areas have been prevented from spending into those reserve. For fiscal year 21 budget, we did allow that areas could use 5% of their carry forward to help with a fiscal year 21. And so that is that will go into that. That's already included in the amount of that budget that will use that. But I did say, it's one time, because we have to look at this each year, and we're planning obviously for the future fiscal years. And so this was a way to say, we've got to meet this pretty significant reduction this year, and then can have time to do better planning for future years. So then on the athletic side, which I will get into a little more in this presentation, that is obviously because we can't use appropriated funds, to shore athletics up. And I'm just going to say this, for the current year, because of the things we've done, we're more or less okay on the rest of the university's operating budget. But and athletics was making great progress at reducing their annual operating deficit. But a huge adjustment like this is obviously not something that we can resolve this year. And so what I'm about to present to you in the next couple of slides is to address a very obvious on this slide, which is to refund debt, just simply to bring in the savings. What it does is it brings in this net present value savings of 13 million, which we can park in as cash. That to me is a no-brainer that we should do anyway. It's eligible for refunding. This does not address the athletics debt side of it. This helps the university's operating budget. So if I can, I'll go through the next few slides, because then I do get into what that means for athletics. Is that all right if I proceed with that, Regent Dickinson?
Can I just?
Yes, thank you.
I just want to ask just a clarifying question, because I want to make sure I understand what you just said, that this that the dollars that we're talking about right now being appropriated funds, for instance, this net present value savings of 13 million, that cannot apply towards the deficit in the athletics budget. Is that a correct statement?
Yeah, and let me tell you why.
Okay.
What we will be refunding, it isn't just, I want to make sure it's not just appropriated funding. Some of the refunding in here would be our housing bonds. They would be bonds that are supporting different types of activities. This refunding doesn't have athletics refunding in it. So that's what I'm saying. So these bonds that are being paid both from our operating budget as well as from housing revenues and other auxiliary revenues, the ones that I'm talking about right now, we would not take that money and set it aside to cover the athletics deficit, because that would just literally be taking the revenues from those sources. That we do have athletics bonds, but we're not proposing refunding those right now because of eligibility requirements and that type of thing. We are looking at that over the longer term, that when we're able to refund some of those and get some savings, we certainly will do that. But if we do so right now, it has negative arbitrage, if you will, because it's, we're looking at all of the different bonds and making sure that once we do the refunding, that we achieve that net present value savings and that type of thing. That's why in this particular proposal, we don't have that. Does that make sense?
Are we prohibited from moving money, this 13 million, to offset another, like for instance, athletics budget?
Might
be a complicated answer. I'm just trying to understand.
I guess I would put it this way, is when we do this refunding, and I should say, I actually, there's details in here that these aren't just one set of bonds, they're multiple sets of bonds. So some of this actually probably does have some athletics money in it, but the purpose of this is to set the money aside to help us deal with emergencies. We can determine in the future, what it is that we need to pay, but I would just caution against taking 13. What I'm saying is I do not propose taking 13 million and putting that to the athletics issue, because we'll create longer term problems then. But what we're proposing to you this year, we'll do each year. We'll go out and see, do we have a refunding opportunity that would result in bringing some cash in? Because there are quite a few, I don't remember the exact amount of our entire debt portfolio that has athletics in it, but they're certainly there. But they're not going to, you've got to remember, these are one-time funds, so they're not going to completely solve that athletics issue. This helps us with our cash flow. If we do what I'm going to propose in a little bit, also a new money issuance, then that will enable us to put that cash away. But I would not say take that and just solve the athletics problem. Does that make sense?
So Stacy, I totally hear what you're saying, and I'm in favor of the concept of restructuring this debt 100%. But as the week has gone on and we've had a lot of conversations, and the Board of Regents is probably not fully aware of this, but the scrutiny and the complete and utter light that is being shined by Senator Billig on the athletics budget right now, I cannot stress to all of you, I mean, this is a Regent issue. This is not a Regent Dickinson issue, but it's being made my issue because he is coming to me directly. But Kirk and Pat and Stacy have been amazing, and we are working through this. But I will tell you, us leaving this Regent meeting today or tomorrow with simply saying we're going to kind of kick the can on the 30 million in debt will be an unacceptable answer that the Regents, this Board of Regents, is going to have to be prepared for answering to Senator Billig, who will raise this up in a very public way. I agree, and I believe and trust, and I feel like I have conveyed that on a very, very articulate level with Senator Billig around the work that Pat Chun is doing and the direction that Kirk is giving as to, let's just start with step one and get this, the athletic budget so it's not operating in a deficit, of which we were completely on track to do that, by the way, pre-COVID and pre-no football season. And then once we do that, we can start to address the debt. It's logical, it makes sense. I am telling the Board of Regents right now, the logic behind Senator Billig's fixation on this, I can't describe, I can't articulate, but it's very, very real. And we, Stacy, I don't believe, and I understand that, yes, you don't take the 13 million and you put that towards, but we are going to have to do something, in my opinion, to demonstrate that we've structurally, that we've done something to at least address the debt. The hope and prayer and concept of more ticket sales when football comes back is not a sufficient answer for Andy Billig at this time. And he has just sent me another round of emails this morning that are very, very clear. And I don't know what those answers are. I know that we probably collectively don't know what those answers are here at this moment. But as we move through what Stacy is speaking to all of you about, I need the Regents to truly understand this is not going away. And there will be repercussions for the Board of Regents and Washington State University to approve a budget with a $30 million debt that we don't necessarily quite know how we're going to attack it. So I put that out there as we kind of move through this, Stacy, so that there's context for the Board of Regents. So I'm not sure anybody else fully has gotten the pleasure and enjoyment of working through what I've been dealing with for really the last 1.5 to 2 years, but it's coming to a head, and it certainly came to a head this week.
Yes, and if we go back to the graphic on the recovery, remember athletics is included in that. So we were making good headway university-wide. What I'm showing you with these is to say that, yes, what we're trying to do is bring in cash so that the cash, so that the accounts have a positive balance and that we will be okay for the current year in terms of a cash flow basis, right? But that doesn't eliminate the need to say you have to have a longer term solution. And let me give you an example, because we will get into this in a couple of slides, is if the answer is to do a borrowing through the Pac-12 or otherwise to deal with that deficit, then what the impact of that is, it's like any debt that you incur, is now you've got to adjust your budget going forward to be able to accommodate that debt payment. So in all of this, that's why I've have been fairly adamant about saying we don't want to increase our annual payment when we do this debt for the university and extend it, is because we understand that we're doing something fairly extraordinary. Not the refunding. The refunding we would do just because it makes financial sense. But when it comes to what type of new money debt will we do, then we've got to obviously understand then how do we repay it and how do we remedy it. And regardless of the debt vehicle we might use to help us with that amount of debt in the athletics budget, is there are future repercussions. It's simple. Has to be more revenues, less expenditures, probably a combination of both. And we just have to understand that those budget practices have to be put into place regardless of the vehicle that we use to solve it. It's such a large amount in such a short period of time. You can imagine, athletics did cut $6.5 million out of this year's operating budget, but now they're down to contractual obligations and fixed costs in most of the areas. And so that's going to have to be sorted through also in this next year.
Regent Dickinson, I'm not sure we're going to be completely prepared today to address the question the way you asked. And so what we may need to do is hear input from you all around this, and we may have to convene a special meeting in 2 weeks to directly address what you're asking, which is, precisely where's the 30 million going to come from? So I don't want Stacy to go through this with this expectation. We have some slide at the end that says, here it is, right, and the Regents either approve it or not. We were not prepared to give that level of detail today. And so if that expectation is there, all I'm saying is we're going to need a little time after we do some of the work Stacy wants to talk about with Pat and Stacy and their team to come back and say firmly, here's our proposal for how we would do that. And I understand Senator Billig's concerns, which I'm copied on as well. And he continues to be very direct in this. Then it's going to take us a couple weeks to put something together so that you all would have something to actually approve.
Kirk, I totally understand that, and I'm not trying to derail anything and or not support what we have been working through all week. I think it's really my responsibility as a region and not yours to express the heaviness that is coming from the Senate Majority Leader on this topic, and despite incredible transparency, and this is a message to the rest of the regents on this call right now, despite unbelievable transparency from Kirk, Stacy, Colleen, and Pat Chun, and the steps and the kinds of communication that they have demonstrated for the past year with Senator Billig, it is not suffice for him. And it really, he is boiling it down to how could a board of regents be responsible or irresponsible enough to be passing a budget with a debt figure that continues to climb, not decrease, in his words. And so I don't believe we solved that today. But I also feel it's really upon me that every regent understand that this is all of our responsibility right now, to be paying very close attention and be thinking through some difficult conversations and decisions that might have to come over the course of time. The answer to say we hope football season's coming back, which we all do, and I have complete faith that we will get to the right deficit, we will move to operating in the black. I know we will. That is not an acceptable answer at this point in time for Senator Billig.
Marty, if he were sitting here today, what would he suggest the solution is?
They're pretty drastic, Heather. And he has been cautious, and appropriately so, to say some of those things, because they're pretty drastic, and they would cause, and he's not demanding them. He has some ideas, and they have repercussions that really are kind of, areas that I don't believe as a region I would want to go down. I would say the one that I think he really needs to better understand, or Stacy and Kirk and Colleen perhaps can continue to help educate him a little bit more around, he doesn't understand why you're not using operating funds to pay down that debt, even if it is just demonstrating some form of payment for that debt, but just that there's just kind of, so I think that there has to be some education around that, Stacy, to your point, around appropriated funds, around contractual obligations. But Heather, they're extreme. I'll just leave it at that.
Right, and one of the things I would say is the actions that we are taking, again, keeps us in positive balances regardless, but it's not a solution, because over the long term with annual operating deficits, then that negative balance increases. So I think we all get that, and that part of it is obvious. It's how do we want, now that we have to kind of revise what the plan was for athletics over the next few years, in which they were scheduled in 3 years to be at a break-even basis, where then we would be working on them paying off that outstanding balance. It's just going to take longer now, and it's going to take a more aggressive action. But again, a lot of this is, if we have a spring season, that might change the current year a bit, and then what would happen in the future. But what do we do in the meantime? So I have a little bit of information on that. I'll go ahead and quickly go through these next two slides, because the second is a debt restructure. In addition to the debt refunding, which I said is fairly obvious. In a debt restructure, we would issue new bonds and use the proceeds to pay debt service on existing debt. Again, it creates short-term cash flow flexibility, but we'd have to adjust our budget to be able to pay that. So this is just the normal, you can restructure, but you have to be able to make sure that you have the increased amount to be able to repay. So a third is we issue new debt and use the proceeds to create cash liquidity. Again, repay it over 10 to 15 years and adjust the central budget. So here is a proposal that we have that we developed with our financial advisor I think we came kind of looking at rates and opportunities last week, was to use a combination of, or to use refunding debt service savings to pay for new debt while not increasing the current debt service. And what that does is, if you see these shaded lines, is it brings in 2.4 million from refunding plus 11.1 million from new debt. new proceeds. And then these blue lines are where those new proceeds are paid off. So again, we reached the goal of not increasing the annual payments or extending the debt. And then again, we have to manage those at the university level so that we hold on to this cash to shore up that deficit. So again, it definitely meets our net present value savings and cash flow to really help us in fiscal year 21. So just think of that, put more money in the bank, you just leave it there while we sort through our budgets for future years. And that is really the approach that we would like to take. It's the one thing I would say though, if we do that, we have delegated authority to refund debt if we meet our net present value savings, but we would have to have delegated authority if we were to do a new money savings, a new money issue to do this. So I think it's the most attractive option at the time, and it helps us deal with everything that you saw before, except for athletics.
Yeah, I guess to me, if what you're saying is it's responsible right now to borrow because the costs of borrowing are so ridiculously low and our overall debt is not out of line for sort of best practices of universities of our size and character, that all makes sense. My issue is, what are we using the money for? Where I really want to see us bias toward using the money not as a way to shore up how we're doing business today, but to accelerate how we should be doing business tomorrow.
Right. And I agree with you, Regent Redmond. To me, this is one of those actions that you take because of the significance of the situation. This isn't something I necessarily would be proposing otherwise. So yes, it is saying, look, put a bunch of cash in the bank, but don't spend it this year. And the next step then is now look at how we can readjust our structure, both by increasing our revenues and reducing our expenditures, realigning over the next 2 years of the biennium so that we can get all of this aligned. This is what I consider emergency action for now, but also that money, we're going to have to be pretty rigorous about how we manage it. It can't just be siphoned off for, as you said, current activities. That's why still getting emergency funds to deal with COVID-related activities are very important, and not increasing our cost structure. So now that all of the areas of the university have gone through this exercise of doing a budget reduction, again, saying, look, this is going to be your budget for a few years. And if the next step then is to realign around those strategic initiatives or where we need to make investments, that then can mean different impacts on different areas as we go forward.
One of the things that struck me, I forget which slide it was way back, I think at the beginning of your presentation, but it was looking at head count, and maybe it was even in somebody else's presentation. Yes, no, that was it. Yeah, that second slide there. So looking at head count in sort of in parallel with this chart, and looking at head count in proportion to students, would be really interested in seeing the breakdown of head count over time. Sort of where are we adding, not only by type, administrative versus faculty, but also by discipline amongst the faculty, and probably a little bit of category in terms of the administration as well. We putting more administration on students' needs, is one thing versus putting administration around, I don't know, I'm trying to think of a category that I would not favor. I guess managing the faculty lounge or something, you know. But can't really think of a negative thing to put that around. But anyway, it's just understanding that better, because it looks like, you know, and I know that our budget is so driven by people and the personnel costs. So understanding that and making sure that we're super strategic in how we move forward on the people side.
Yes. Yeah, and that is part of a good budget model, where it's not just breaking down faculty and staff, you know, for accreditation purposes. We have to be mindful of types of faculty and those types of things. So again, that is something we look forward to being able to isolate that information better on our new system, and as well as benchmarking. We're looking at benchmarking certainly for Drive to 25, but there's also tools for administrative benchmarking that I think will be important to incorporate into our process also.
Stacy, that slide that you were just on.
Okay, back. I'll go.
It's my favorite slide that is in this entire board packet. And so I just really want to take a moment, and I know that there's been some others that have praised the work. It's certainly appreciative that you're at the forefront of building these muscles, and I think they're really going to be important moving forward. The idea that we'll be out of some sort of COVID crisis in a matter of months, I think, is probably too optimistic. And this is a tremendous achievement. And so I know that there is a lot of worries and a lot of challenges facing us, but I think we all need to take a moment to celebrate this. So good work, and good work to everyone here on this call and beyond, because this is a huge amount of effort. So well done.
Thank you. Again, very much a group effort. And we were so looking forward to having a different type of budget year this year. So anyway, but like you said, it's very important that we got that achieved. So
and I think that we know that we can achieve it, which for me is really an important element in moving forward. I had a little bit of technical issues and then ended up having to call back in, which meant that I missed a key element of how these two elephants, budget and, you know, the ability to achieve something that you've been working towards for the last 3 years has been accomplished. And yet we have just a continuing massive athletic budget issue. And so I heard Regent Dickinson mention, you know, the interaction with our elected officials. I just want to make sure, because I know these meetings move quickly, there will be a healthy conversation in the agenda item around the athletics budget later on, and that this isn't necessarily the time in which you want to dig into some of those questions. I haven't had the benefit of spending a lot of time really talking through what some of those levers are. So just seeing the information and looking at a new accumulated deficit of 114 really kind of was shocking. And it's hard to separate the two, but I just want to just kind of better understand. It's at the very end of our agenda today that that we will have time to talk through that with you later in the meeting. Is that correct?
Yes, that's correct. And on this is my last slide for this presentation. So the second bullet does talk a little bit about that. So first is, you all know this, use of debt to create required cash liquidity is a one-time solution. And in other words, we're taking an action that I think we've put the appropriate requirements around it so that we can achieve it for this year, and it puts us in a good position. We will continue to look at what those options might be for future years, but I just don't want anybody to think that, oh, well, you can just go out and, you know, borrow this amount each year, because that isn't going to be the case. So we'll evaluate that very carefully. Many of you have probably heard or read about, there is a discussion in the Pac-12 about doing a financing in which they would, each institution or some institutions would borrow a certain sum of money to get through the next year or so, I say. And then that repayment would come from the payments that would come through the media revenues. So what it does is it's not the university repaying it, it's repaid based on the distributions that athletics gets. We have to evaluate this both in terms of, is the Pac-12 willing and going to be able to do that? And a lot of work has been done on that, and we continue to have discussions, because frankly, when this topic first came up, I can't remember if it was around a year ago or so, there weren't that many interested institutions. Now there are a lot more, and for a couple of reasons. You can imagine the Pac-12s were all kind of taking a hit with this situation in which we're not competing. But also, in the case of some institutions, there's concern about, quote, using the university's debt to help with that athletics budget. Wouldn't it be better if we did it through the Pac-12, where it comes out of those revenues that go directly to the athletics? That's really been the nature of our discussion. I also can't answer for you today whether it is a vehicle that WSU and maybe even University of Washington can use, because of the type of debt it is. So we have people looking at that. So what that is, again, is it's intended to say it's the conference recognizing that this is creating a problem for all of its institutions, or at least most of its institutions, and might we be able to just take those future media revenues and give some cash right now that would help shore up those balances. So that is one that we're continuing to look at. Probably can talk about that when we do get to the athletics budget, because I am being very clear here is that it is a big deal. It's a big situation. But at this point in time, the solution, in my mind, it would be premature to say that the university needs to take this on. But I'm going to repeat, we do cover the deficit balance, but over the long term, that needs to be remedied, because what's covering those deficit balances are funds that belong to other areas, like, for instance, housing and dining reserves. They have reserves because they're self-support and they have to do their own remodels and their own repairs and all of that. And so I refer to them because they have the largest reserve. However, because of the situation with COVID, they're having to spend into those reserves, this year, just because of having such low occupancy rates. So that's, that was the tool we were using before, just to cover it while athletics was recovering, but it makes it a lot more difficult this year. So what we've been doing is kind of looking at what are our other options in order to be able to do that, but also working with athletics and how they can certainly reduce current year expenditures, but what that would look like over the longer term. Because even with the Pac-12 situation here, remember, that would result in them getting less revenue in future years. So it is, in effect, a permanent budget reduction, whether it's because of not receiving less revenues and likely additional expenditure reduction. So does that make sense what I'm saying about what we have so far? But this isn't a done deal, and I have not presented you with a financing that would cover that deficit at this meeting. So you're right, that's it's not resolved at this point in time. I think it would be very difficult to resolve something like that within, the few months that we've had since the, I guess it's not even, or barely over a month since the announcement of no fall season. But, clearly we have a lot more work to do. The third bullet, I anticipate these economic impacts extend beyond fiscal year 21, and that's why the thinking toward the future and some of the things that Regents have mentioned now obviously go into effect. In other words, what we're doing in fiscal year 21 is not going to work fully for fiscal years 22 and 23. There have to be different adjustments and different solutions for those future years. And then The fourth bullet, short and long-term cost structure adjustments will be needed, partnered closely with changes to our education and service models. I think there are lots of things to be learned that we have to learn at a university, and I would say even as a society, about how we can operate now that we've had to jump so quickly into things like remote learning. And so, I think as we look to our future, it's not with the idea that things go back to the way they were 100%, but that we're going to be in a different world, and how can we take advantage of the efficiencies that we've identified in this process, as well as, educational delivery in the future and administrative operations also. And then finally, just to say that while we were going to develop our new budget model this year, I think it's important that we still do develop that model, because again, that helps us allocate our resources strategically. It likely moves us away from across the board increases and decreases and that type of thing, but it also enables us to bring in revenues for new investments. That's the end of my slides. And again, we do have that action item on the agenda to delve a little bit more further into the athletics budget. But I think I'm telling you here that we are looking at some solutions for the current year, but we don't have, we have the ability to, quote, keep the university in a positive cash position, but that doesn't solve the problem longer term.
Stacy, are you looking for perhaps a future action or an action to be amended to this agenda as it pertains to getting approval from the board for this proposed concept of restructuring some of this overall debt?
Yes, for the new money issuance, given that we were able to come up with this last week and didn't have it on the agenda, if the regents are amenable, that's what we would be seeking.
And will we be seeking, is there something I can do to help advance that, Stacy? Because that would need to go for tomorrow to take action, is that correct?
Yes,
okay.
Yes. And we have drafted a resolution and a motion if that is the desire of the regents.
So can I ask Chair Blankenship, is there any heartburn that comes from the regents at this time to be able to look to move that forward and advance that tomorrow?
If I don't hear any objections, I think that would be the consensus of the board to seek out restructure. Am I correct in that assumption?
That was a little too convoluted for me to understand. Marty, can you say that again?
So I'm looking to from the Board of Regents, confirmation that we are comfortable moving forward for this to be an action item and a vote tomorrow, Heather, as it pertains to the restructuring of debt and what Stacy just proposed.
Yeah, I am, but I feel like, as I think that you and Lisa have said, we have to do something on athletics. So I think getting the money makes sense. The question of how we are deploying it is the part that I still have questions about.
Yeah,
and whether athletics is part of what we're deploying it to support.
Yeah, I think we were, again, prepared today to talk about it. We'll talk about athletics in a minute, but I think we were prepared today to talk about the restructuring and hopefully to get approval from you all as regents to do that. You made it really clear that we also need to talk about how we would use the money. And so I think clearly we would come back to the board at some particular point, probably in the November meeting with, okay, here's what the net revenue was. And here is our proposal for how we would be deploying those particular dollars. I mean, you all made it clear you'd like to know that and have some discussion around that. So, but I do see the two things as a little bit independently from a board governance point of view, is we need permission to actually go get the money. And then the second part is details on how you're going to use the money. And we're more than happy to share exactly what our plans would be around that at a subsequent meeting where we've thought about future stuff. We've talked about the need to more aggressively do marketing and communications and some other types of things, as well as to hold some cash, we would want to come back and say, here's what we propose to do.
Yeah, and what I am actually proposing for fiscal year 21 is that the money is held. There are still unknowns in the current fiscal year. Spring enrollments and potentially further state appropriation reductions. We don't know that for sure, but again, I'm viewing this as cash in the bank to be held until we can determine what our future might be, particularly after the session.
So
I always think, sorry, go ahead, Marty.
Well, I was just going to ask for Regent Redmond then, and maybe Stacy, that if we were to put that language specifically into the proposal and vote for tomorrow, I think that would probably be necessary and appropriate, Stacy, that the proposal is we restructure the debt for the intent in which we would hold back cash for a period of X amount of time, with the understanding that we would come back around to do a reevaluation of how that spend occurs, and an expectation that there's going to be some structural changes from an institution standpoint happening, so we're not going back to doing business as usual. I don't know how we word that, but I do think just that holding the line or holding the cash might be something necessary to put into the language.
And you all as Regents can do whatever you want to, right? I want to make sure that we're separating out our ability as a senior leadership team to manage the finances of the university and being held accountable. I worry that we're picking a particular action and we're going to put constraints on those particular dollars instead of saying we're going to allow the university to move forward and generate those dollars. We expect the leadership team to keep us informed and have a discussion around how they're going to be used. But I think it sets a bad precedent to start saying for a particular financial action, here's how that's going to be done or not done. I think that ties our hands somewhat, and maybe you say your hands ought to be tied, but I would prefer that we keep it higher level and have an accountability expectation by the board and us visiting with you, as opposed to putting too many constraints on holding it or spending it or whatever at this point in time. That's my preference, but if you disagree with that, then we'll do whatever you want.
Oh, I appreciate that, Kirk. I appreciate I understand where you're coming from on that. That makes sense to me. I just got to ask, what are the other regents on this call thinking about kind of this scenario? Certainly Lisa and Heather and I seem to be pretty engaged on this topic, but I'd sure love to hear from the other regents that are, absorbing this information on this kind of really critical juncture that we are at the moment.
This is John Shuttler, and at the risk of being absolutely brand new, and I really want to be a sponge and just soak all of this up. I think Stacy addressed some of it, but my biggest concern would be in the area of what I would term dogs not barking. Meaning, what are we not thinking about? What is it that we don't know with regards to how COVID may actually frame our world beyond 2023? I think we're making lots of assumptions, and I think I would love to see some real detailed models, or at least understand the modeling that goes behind a 3, 5, 10-year plan. Just to see what revenues look like. What happens if we really don't return back to campus? What happens if our teaching methods resort to mainly online? I just think that, I'm doing this at Amazon right now. We're trying to wrap our arms around a worldwide operation from a corporate real estate perspective of 44 million square feet in 56 different countries. And what happens if employees only return to the office 2 to 3 days a week. And I'm not sure that, and it may be just because I'm so new to all of this and don't know all the thinking, but I'm just curious whether we have really investigated and really thought and done a deep dive on the dogs not barking.
It's Enrique Cerna. It's a lot to consider. I'm still kind of, I don't, what is the problem with billing for one thing? Because I don't understand that. I'd like to have some more insight about that. But I also, as far as the actions that we need to take for now, I think what Kurt brought up is, for me, a more comfortable way to go, because I think that I don't want to rush into these things too much, but I'm also trying to understand everything as well. So anyway, those are kind of where I'm at on these things. But there's so many unknowns, I think, that, as John brought up here too. So I think we need a deeper conversation before we make any decision. That's sort of where I'm at.
I'd like to weigh in. One of the reasons I've been fairly quiet is I wanted to really hear what Stacy had to finish saying before I jumped in and said anything. But we have had a system for a number of years where we actually have controls of where the university has flexible spending and when they come to us to make decisions. So I feel
Must have a technical issue.
She wanted to hold us in suspense.
Yeah.
Brett, maybe another region wants to speak, and then we can come back to Laura.
Okay. Yeah, Laura, I don't know if you can hear
Can you
me,
hear me?
Laura.
Can you hear me
Now
now?
I can hear you. Now I can hear
Okay.
you.
For some
I
reason
missed
or
most
other,
everything.
I keep getting kicked out. But at any rate, the system that we use on a regular basis has various levels at which the university needs to come back to us for new programs, to eliminate programs. And by and large, there are levels where we both allow but expect Kirk and the university. Can you hear me still? It just changed.
Yes. Yeah.
Okay. So there are levels at which Kirk realizes when it's time to come back to us for any action or proposed action. So I feel very comfortable with the context of a proposal that Stacy mentioned could be brought to us for action tomorrow, but without having any, having come back with us for any action, unless it's an action that is customary to be brought to the regions as far as managing. The other comment I have on the athletics budget, and it has been expressed, but I just want to reiterate it is that we have quite a few constraints about how we spend money and the different colors of our money. So solving the whole athletics thing is not a trivial exercise of just taking money from one place and putting it in another. And it's my understanding is that it's a legal restriction. So we do need to do that, and barring, unless the Pac-12 decides to do what the Big Ten did and go back and have fall sports again, we're going to have a very significant issue in moving forward and trying to resolve this. I know there's a lot of knowledge within the university structure, and I think maybe waiting the 2 weeks that Kirk mentioned and coming back for some well thought out solutions is a good practice.
Any other thoughts? Thank you, Laura. Any other thoughts around the table?
If I can speak, I'd actually think that the 2 weeks is actually really good, just because I think that we do need to take some action, because as a board of regents, we kind of are at the very top, and it like we need to show some leadership, that we're not just kicking the can down the table. Because, excuse me, in my time as like ASWSU, I've seen that like when we gather as like student leaders amongst like all the different campuses, because we have all these like, different views and we're all scared to take action. A lot of times we do kick it down the road. I feel like that's not really like a great sign of leadership, because at least for the students, like we want to know what's going on, because a lot of the questions that I get, like with what is COVID affecting like our money, like because a lot of them are like saying like, well, I pay the same amount of money, how am I getting like, I guess the same amount of resources or like same education and quality? So like they want to know like where their money is going. So I feel like the best way to like help like the students feel at ease, even if they're not happy like with like, because a lot of them have asked for like some type of tuition reduction, stuff like that, which like I don't think like in terms of the business models, like I don't know how feasible that is, but I think just letting them know like where the money is going and showing them like, hey, we're looking to this is like, okay, we're like looking to spend this, we're looking to make cuts here, so that they can say like, okay, like I'm not happy, but at least I know where it's going, so that like we're showing our leadership as a board of regents. I definitely don't think we can have it ready by tomorrow as a votable action. So I like that 2 week proposition that was proposed. So like that's my input, at least for the students to know like where we're going, that we are looking to this, and it's not just like, oh, like this is our idea. It's like, no, we have like these like step plans like of the things that we are aware of. Like granted, I know that things will be changing. I don't know if COVID will go away, at least in the hospitals. A lot of that I've been working at the 2 hospitals that I've been to, Sacred Hearts and over at what is it, Providence. We've looked at it and like they're planning that this COVID is going to be around and affecting the healthcare for at least until 2024. So I'm imagining it might affect us that long. Maybe it could be gone by next semester, but I think that like we should at least be looking at things that we can take, like we know right now, yes, there are like dogs that aren't barking, which is like very good. We need to consider all the different variables and changes that are going, but I think at least as a sign of leadership, we should look to do something. And I like that 2 week time to give us at least kind of like the proper words. Sorry, I'm like thinking faster than I'm speaking, but I think at least for the students, it puts them at ease so that they can understand like we are doing something. Does that make sense to everybody? Just because for the students, like, you know, like I know for them, like even for me, it's like learning online is like very tough. So like they want to feel supported. So I think showing them where their dollars are going and like understand like, okay, like we are in a hole, like in debt, and like we are addressing it. We're making these cuts, so like at least that they can see that we're taking action and being like leaders and like make like, I guess, not kicking the can down the road. I know I used that analogy like 3 times already in like the last 2 minutes, but I just like feel it's important that we show leadership and show that we are doing something for them, so that they feel like their voices are being heard, that like they're not being like left behind. It's like it's not just dollars, these are like people, like this is their education that we're talking about, and that like we really care about that, so that like when they go out into the world, and that like if they have to adapt to COVID and this is like what the workforce will look like for them, that they're prepared as well, and that that the quality of a WC education is as high as we'd like it to be.
So let me step in. I'm trying to assess whether there's consensus on Stacy's proposal and to discuss further if we're going to take action, consider taking action tomorrow on restructuring some of our long-term financial instruments and seek savings while rates are low, and expect the administration to come back to us of how those funds, how the savings might be distributed. Let's focus on that right now. And so I don't know whether I need to hear a motion to look into that or just discuss it further, but is there consensus to have Stacy come back with some language like that for the Regent meeting tomorrow.
Yes. I think that for me, I think we definitely need to move forward with the, any restructuring of debt or refunding now. What the 2-week thing I think that we were discussing had to do with figuring out how to deal with the athletic deficit. And it's not for the bond refinancing. That's my understanding.
Mine too.
I concur with that too, Laura. That's my understanding as well.
Yep, absolutely.
Yeah, that's what I heard.
Yeah, I guess which means, I think, Marty, don't let me put words in your mouth, but I think the language that you were seeking to insert about the, how is the money spent is not what we would seek at this time, but instead we would probably, maybe it's worth doing a resolution, I don't know, but some sort of statement in the minutes that indicates that the Regents want to see a very comprehensive plan regarding not only how, what we are spending on and what we're not spending on this time around with a particular concentration on athletics, but a longer term plan, as John outlined, for preparing for contingencies that, that go far beyond the spring term in terms of the impact of COVID. So I don't think we're saying this pot of money is in some way special. It's really that we need to take a comprehensive look, and that we want to be deeply involved in that, and that we've got a particular eagle eye on athletics as one of those things that we just have to solve quickly, because it's such an obvious place where status quo is not going to work given COVID.
So if I don't hear objection, I would ask Stacy to draft language similar to that, and we can take action tomorrow or not, but at least discuss it tomorrow as a board. Are Ted or Ron on the phone? Would they like to weigh in? So I guess it's just us. So, are we all okay with that? I think we can. Yeah, we think we can revisit that tomorrow. Yeah. So, thank you for the robust discussion. Are there more issues, Stacy? Is there more on your presentation?
No, I thank you, Regent Blankenship. I'm finished with my presentation, and I appreciate the support.
Well, that's good news. So then let's move to item 4, mandatory student fees for the academic year. Some of us have had questions regarding that. So if Stacy or Mary Jo have more information for us.
Absolutely. I'll let Stacy. Stacy just took a series of questions. I'll go ahead and step in onto this one. I'm sure that you all are, just like I am, dealing with a significant amount of emails and phone calls from parents and families. I think, Regent Dickinson, you said the heaviness around these financial scenarios for students, particularly around student fees. I do want to give you a little bit of the background. It won't be very long, but definitely want to open it up to questions for you. When we moved to remote operations in late July, the Student Government Council was pretty clear about asking to be more involved in decision making. And so when I approached the leadership team about this particular issue, we believe that it was really important to put students back into that. We have approximately 15 student governing bodies that deal with fees across the WSU system. Several of them are guided by the RCW, and so we have to go through a formal, specific process. Nearly all the committees are formed. We have 1 or 2 that are not. We're still waiting for a few appointments. It would be important to note that for the student fees across the system is that all are still operating. All of them are still moving forward. All of them are still being managed and navigated just as they would in terms of the remote operations versus the in-person operations. That includes everything from counseling to student engagement activities, as well as student involvement activities. I would want to signal to you, this actually relates very significantly to Stacy's presentation just a few minutes ago, is that there is a sizable portion of debt on the student fees. The fees are about $705 a semester on the Pullman campus, of which about 2/3 of that is going specifically to debt payments. The rest of that is, even if we closed facilities, we would have maintenance and operation costs that go along with that, including insurance, bond debt payments, as well as maintenance and operations that have to continue even if the building is closed. We are in a 5-year period of high debt repayment for the majority of these facilities. That's going to go on for another couple of years. And I wanted to make sure that I had from you, if there were any questions that you needed specifically around student fees, we are generating a list of talking points for you that we're going to get to you after this meeting.
Any other questions for Mary Jo on the fees? Thank you, Mary Jo. I look forward to the talking points. The next item would be a Chief Compliance and Risk Officer report. Cheryl, are you ready?
I am. Thank you.
Yeah, thank you.
Good morning, everyone. It's a pleasure to be here. And this is designed primarily to be an introductory report. It's not in depth. I do feel like this whole conversation's been teeing up risk conversations. As the agenda item noted, I came into this position 2 months into COVID, and nothing like coming into something that's a real-time, enterprise-wide sustained risk event. And I think a lot of what I've been doing since then has been day-to-day addressing risk issues, but also have wanted to give you just a brief summary of some of the structural issues and efforts we've undertaken on both the compliance and risk side in between addressing the COVID risk issues. So on the compliance side, we've been working with the various compliance units, out meeting the compliance groups across the university, and working to really embrace a principled compliance approach. We will be setting up a university-wide compliance committee. But first and foremost, and the focus has been on our health sciences compliance. And we've restructured our civil rights group to be a compliance and civil rights group to give more visibility to compliance while maintaining the visibility for civil rights issues. And included in that group now is a health science compliance group that is starting and taking on the policy initiative towards HIPAA compliance specifically. So that's been going on, and it actually has related quite a bit to some of our efforts in response to COVID, because we've had some HIPAA compliance issues that we need to address on the fly. Over on the risk management side, there's so much to say, I think, in terms of what is going on, how it is addressed, and what we can and should be doing. I think that we looked at the enterprise risk management program we have going on right now and realized that everybody's risk has changed. The response to the risk has changed, and that what we really need to do is step back from that and look at the risk, the big picture enterprise risks, I think as Regent Shetler was addressing, that are behind COVID. What is it that is our most critical driver? What is it that are the core elements that we need to keep in place to maintain those critical drivers? And how do we engage and create input from across our community to do that planning? So that is on my list of things that I believe that we need to be doing going forward in the really big picture. In a more day-to-day sort of stuff, I think we need to do continually be risk aware in our COVID response and have been helping with that in elements from the research response to the testing response to our return to work reviews. I think that we all recognize that we are building the plane as we're flying. It's very fluid. Nobody's making a perfect decision, but we need to also acknowledge when we make imperfect decisions, learn from our errors, and critically look at what we have done. And then embrace the opportunities for change and learn from our mistakes as we go forward and seek to improve continually as well. So those are, sort of the guiding factors. What I would hope to do is next time I'm in front of you is have a more sustained report that reflects some of these efforts. Again, this is really just an introduction. And then, sort of in the bag of other things besides COVID, one thing I've also been working to do on the risk management side is take a look at, significant events that are happening, risk events that are happening, how we create awareness of those events and have an enterprise-wide or system-wide response. And so I think that we'll be talking more about that later today. And also on the risk side, started one major policy initiative there as well, and that's to address minors on campus, which has been an ongoing area in need of policy and presents without doubt a continuing risk. So I welcome questions or comments and thank you for the opportunity.
Thank you. Any questions for Cheryl while we have her on?
Brett, I have a
Laura.
question. First, welcome, Cheryl. It's great having someone in your position now full time. One of my wish list items for since I've been on the board is to have a good enterprise risk discussion involving both the board and the senior staff. And so I'm hoping that sometime in the future, we can schedule that. Of course, having said that, while the possibility of a pandemic often will make these lists, no one could probably have predicted the impact that we certainly have felt from this to date and going forward. So, but I think it's just a good practice to engage the board at some level during these discussions. Because just as John brought up this morning, which dog's not barking comment. So I think it's good, and glad to have you engaged.
Thank you. And I think that is something I would welcome. And I do think that it will be shaped significantly by COVID and needs to be so that we make we make it a useful effort and something that can help guide the university going forward.
Thank you, Laura. Are there other questions or comments? So for now, I'd like to take a quick 5-minute break, and then we can come back and plow through some significant parts of the agenda. So let's come back at 11:35.
So you mean, Brett, we haven't plowed through some significant?
Oh, I got a long list coming up. Thank you all.
Those are the only ones that are showing their camera right now.
Okay, are we on then? Okay, I believe we're live again. So next on the agenda, we had the internal audit update.
Like, I feel like Kaylee's so upset and frustrated.
Yes, I'm here.
So Heather, are you on?
I am. Thank you.
I don't see your photo yet, so we're
I'm
having
on.
some technical problems here.
Good morning.
Morning.
All right, so I'll try to be brief. You have two things in your packet from my office for your update. One is a revised charter for our office operations and also the annual report. On the charter, just a really quick thing. The only revision is made to have my reporting to you be on a semi-annual basis instead of quarterly. This is to align with the Board of Regents change to their policy. And so we're all aligned now, and I'll be seeing you twice a year. On the annual report, this is really my opportunity to just kind of recap from the last year, our approved audit plan, and don't do any like deep dive into particular audits, but I will take questions at the end if you have any. Just kind of a reminder, our office, internal audit, we have a couple of services. It's not just audit. We obviously do planned audits. These are activities that provide assurance to management that controls are working adequately to meet management's objectives and reduce risk. The planned audits that we do are identified through a risk assessment that is done on an annual basis. And just to note, for the fiscal year 20 audit plan that I'm talking about right now, that risk assessment was done back in May and June of 2019, and the audit plan was approved in July of 2019. So a lot has changed since then. The combined effort on the planned audit activity for fiscal year 20 is about 3.0 FTE, 3 full-time officers or auditors for the last year. We also do advisory services. We have a lot of questions. We field a lot of questions about internal control processes, policy, implementation, ethics for my role as ethics advisor. And we also are liaison with external auditors, and we have seen some increased activity in the last year with external auditors' interest in WSU. And the combined FTE for fiscal year 20 was a full auditor to engage in just those two things. And then we also do investigations of fraud, waste, and abuse. And that activity took the equivalent of a full-time auditor. So the ratio of time on planned audits was not ideal. We usually want to have about 70% of our full audit complement on planned engagement, but that didn't happen. Things happen, that's why we have a contingency budget to allow for those other activities that are unplanned. Through necessity, since March, we did have to reprioritize our activities. So we took a look at what we were doing, how we were doing it, and what we were going to do going forward. And you can see in our annual report that we had a couple of audits we just were not going to be able to engage. We had to drop those from the audit plan. They don't go away forever. There was a risk at one point that put it into the audit plan, into the risk pool. They go into a future audit project file that gets reassessed when we have the resources to pick it back up again. There were 2 audits, though, that were in our audit plan that as of June 30th, we were not able to engage, but they are still going to be engaged. We're starting on them right now. We did a reassessment of all of the audits, and those 2, they're both in the IT arena. We determined that they're still of significant risk. We really do need to get to those. They can't be pushed off to a future risk pool. So those will still be engaged. And that's on the IT audit plan, identifying the risk model and programs that our central IT are utilizing so that we can adjust our approach accordingly and evaluate what they're using. And then the other one is on IT governance as a whole, and that'll be a collaborative effort. So none of the activities, as you would imagine, in the last quarter were foreseen. And so none of the audits that were in our fiscal year 20 plan really addressed taking a look at controls to look at anything that's going on right now. What we have learned, and I've heard a couple of people talk about revisiting the way that they're doing things. We will be revisiting how we're doing things. We were already having some changes in our audit approach. Audit will always be here to provide a service to management. We're here to help management in evaluating those controls. That's always going to be our primary objective. How we do it, we need to be more nimble. To do an annual risk assessment with an annual plan, things change so quickly, sometimes the next month. We are evaluating right now how we're going to change that. And I can tell you, internal audit as a profession, not just in higher ed industry, but all over the place, they've been looking at this for a couple of years. We just can't stick by the old, a 1-year plan or 2-year plans as some places have it. We have to be able to be flexible to really assist management and address those risks more timely. We have been doing this in a form for the last, I would say, about 8 years in our continuous audits. And we continue to have our continuous audit approach. That's where we do throughout the year data. We pull data on a regular basis on all P-card transactions, all travel transactions, all payroll, all cash. And we identify through data mining and queries that we've developed and we're constantly refining where there's some maybe anomalies that need to be looked at. And we go in, we look at them when we find them, and we report on them. And that's really the approach that we're looking at. It's a lot more real-time, a lot more helpful to management because we can get the results to them and they react and they develop corrective action plans almost immediately and move on and make sure that a lot earlier in the game that we have appropriate controls over activities. So we're going to look at that approach for our other planned audits and maybe on the audit plan as a whole as we go forward. And you'll hear more about that the next time I come to you with a report in our next audit plan. So just a really quick summary of where we're at on some areas that I wanted to highlight. Just a note, for 3 full months, the last quarter of the fiscal year, I had 3 auditors that were out those entire 3 months. I have a 6 auditor team, so that's quite a loss of resources, and it was due to daycare closures and medical reasons. During that time, while everybody was dealing with response and figuring out how to manage what was going on, it was not appropriate or helpful to management for us to demand to see records to support transactions. So we did pull off, and like I said, we reassessed the audits that we were engaged in. What's really now the risk? Is this still a risk? And how do we need to modify our approach to it to still get to that end and provide some service to management? So we did reassess and change some of our audits that were actively engaged through that. We didn't actually do on-site testing. Most people weren't on-site anyways, but we didn't have departments go back to the office and find records or dig in the archives. Instead, we took the time, the opportunity to do that reassessment. We did a lot of data mining. Data is out there. It is available electronically. And we were still doing the continuous audit approach of looking at data trends and anomalies and evaluating it from that perspective. And in that time frame, we were still real-time addressing the advisories, the questions that come in because they don't stop, the complaints that come in, and the external audit requests. And that pretty much kept us busy in that last quarter. From a control, yes.
Somebody's typing and they're not on mute, and we can all kind of hear. It sounds like a manual typewriter going on. So if people aren't talking, if they could make sure they mute, that would be really super helpful. Sorry to interrupt.
No problem. So from a control and accountability standpoint, back on those advisories, the type of questions that we've had coming in really since February, they really speak to, you've had a lot of visibility. There's been a lot of visibility on actions and decisions that have been made to deal with this crisis and the ongoing issues. behind the scenes, as you know, there's a lot of activity there as well. From the small fraction that comes to my office, and it was a large volume of questions and inquiries and meetings and discussion, it is evident from the type of questions, like, how do we do this and still be accountable? How do we change this process or make this happen and make sure it doesn't implicate ethics or create compliance concerns? It still demonstrates that even in the crisis situation, there's a culture of wanting to make sure that we're doing the right thing in responding. So that's something that our office, when in all of our audits and we're doing our risk assessments and stuff, it's always, you got to have a pulse on what that culture is and that tone from the top. And that's very important for you to know as well. Two big areas that just a little brief, IT. IT data security, as you know, has always been, as far back as I've been here, in like the top 3 risk areas that you've been concerned about, industry's concerned about. It's always it's a high risk area. And no different at WSU or higher ed general. So we usually have a few IT audits on our audit plan. Most of them are focused on evaluating the controls over data security, network security, et cetera. And we still have a few active audits going on, but we did spend quite a bit of time trying to work our way through those outstanding IT issues from audits past. And there has been progress. In the annual report, it looks like there's still a lot that are outstanding. I do want to make a note on that. They are outstanding, but recognize that the example, like a standard configuration of endpoint or servers, something that the university as a whole, as a system, will make sure that they're all on the same page, and whatever standard they've implemented meets minimum standards of, say, NIST or state information security requirements. And for the most of them, the policy and the publishing of the policy have been done. Not all of them, but many of those outstanding, that first part has been done. It's the second part of most of those recommendations that has not been completely done, and that's it's first develop and publish a policy, and then it's implemented. And we can't put a lot of those recommendations as fully resolved until we've seen that it's been implemented. So we do work very closely with the IT team, not just here in Pullman, but at other campuses to evaluate what they're doing to implement those policies, how they're doing it, and we'll be testing to make sure they're effective. Once we've been able to do that, we'll be able to say that those are resolved. But we are continuing to work with management on plowing our way through those. The other big area that I wanted to talk about was compliance. Compliance is another one of those areas that's been in the high risk for years. I have so many times in the past that various regents have asked me, what keeps me up at night? When I'm usually asking you that question and management that question, what keeps me up at night? And my standard response has always been IT data security and compliance. We are such a vast enterprise. We're so spread out, so decentralized. We do still have a lot of silos. There are so many regulations out there. We don't know all of what we don't know. The university's implementation, the creation of this chief compliance office, and I'm glad that I came after her in the agenda, but it is long overdue and very essential to the university, especially as we grow as an enterprise. It's not that the compliance function owns the risk or owns the processes. It was very, very important to have a coordinated effort, somebody that can collaborate, facilitate getting those out risks all pulled together and the units talking with each other, reduce redundancy and make sure that we're addressing them. And so there's a lot going on right now, and it is trial by fire for Charles, but for what she's and her group has been tackling so far, that's exactly the direction that the university needs to go. It's unfortunate with what's been going on that she's delayed in really deploying all that function can do for the university, but it's definitely a huge positive in the right direction. We will probably continue to have compliance audits on our audit plan because, again, we provide assurance that it's working as designed. Compliance function will be working with management to develop the policies and identify the risks. We're just coming in after the fact. But we do work pretty closely together since Charlotte started. We have our regular meetings, and there's a lot to work on. And I think that was about it on the highlights I wanted to address from the annual report. Lots going on, but we're working really not trying to burden management, but still be effective in the service and evaluating controls and processes where we can. There was in the audit plan for fiscal year 20 an allocation for spending time on modernization. Most of our effort has not been in the fiscal year 20. It's been in July, August, and actually just most recently, so the last 3 months. So we'll report on that later, but we've been spending a lot of time working with the modernization team on the business processes. It's just a little bit later in the game than we initially planned on. So that's it for my report. I'm happy to take any questions.
Any questions or comments from the board? Thank you, Heather, for your accountability function. It's very important. Thank you for reporting to us. The next information item is an update on the modernization initiative. Stacy and Matt are back on.
Yes, I just want to remind everyone that we are now 3.5 months from go live on our new Workday Finance and Human Resources system. This is something I know that we've been discussing certainly since I got here, and I think well before. Obviously, these last few months are critical, and I'm going to ask Matt, we are tight on time, to kind of quickly walk through what some of those key issues are. There's also a write-up in your packet to give you kind of a sense of where we are. Go ahead, Matt.
Before you go, Matt, let me just, for John's benefit and maybe Enrique, the modernization initiative is a huge platform to bring all of our financial controls under one roof, so to speak. Whereas the university functioned in a lot of different bunkers financially. It was tough to get real-time reports. And this has been a huge effort to implement a system-wide plan called Workday. So with that as background, take it away, Matt.
Thank you, Regent Blankenship. That's great context. And as Stacy mentioned, we'll be brief here in the slides, knowing there's other critical discussions today. So this is a project timeline we've all had opportunity to see several times. The big change here is we're now communicating dates when the campuses will begin using Workday. The first is in the middle of December. We'll begin using Workday for payroll and some essential human resource processes. So that will be the first exposure that the university community has to Workday. Then we'll follow up that after running our first payroll in Workday with launching the rest of all the Workday functions across finance and the remainder of human resources on January 1st, 21. So it's exciting to get to this point. Also a reminder, when we see this slide, we always note that the launch of Workday is right in the middle of the project timeline. We do expect a very real stabilization and support period that we are gearing up for to support all of the university community as they learn new ways of working in this system. I just need to recognize the many people that have worked so hard in the last 2 years. Our modernization team has been outstanding. Individual finance and human resource professionals across our campuses, colleges, and areas, all of them have dedicated so much time and effort over the last 2 years. They've given their best, and we're really pleased with the work that's been done to date. That said, with 90 days left until we run that first payroll out of Workday, there is a lot of work to do. This slide is a summary of those major steps that need to be completed. We're just finishing up user acceptance testing right now, which is going well. We're also finishing payroll testing for the 3rd time, and I'm pleased to report that we have cleared the threshold from Workday on the successful results of payroll testing, meaning that they would allow us to move forward using payroll and Workday. So really outstanding. That testing is very detailed. They literally run in our legacy system in Workday every employee line by line on their paycheck to make sure we're discovering any differences. So really appreciate everyone's work there. I'd also just highlight two other things on this slide as we prepare for launch. Over the last 2 years, a common question in the university community has been, am I going to get training on how to use Workday? We're excited to say yes, we will have training available for Workday. This is a sampling of that. We have 31 instructor-led courses that are out and available for enrollment now. Those will be offered 430 times in October through December. Massive effort from our central offices to provide that much training over the next 3 months, even while they're dealing with the pandemic issues. We have 32 self-guided micro-learning classes that individuals can take at their own pace, and 130 quick reference guides that are built to help individuals know how to perform key transactions like travel reimbursement, initiate a recruitment, those types of activities in the system every day. I'd also just point out another area we're watching closely here, and that's data conversion. This will be our fifth time that we've practiced converting 2 million records into Workday. We'll begin that work next month, but that's something we're watching really closely. And to be honest, that is the only thing that would keep us from going live at this point, is if we had issues with the data conversion. At this point, everything else we feel like we have custody over, and we would move into stabilization and keep working on it. So those are just some call outs. Things we're watching for our project. There are some challenges and risks. The first 3 on here are kind of configuration items that we are taking care of. We have custody of those. We believe we'll have those wrapped up. The bottom 4 on this list are larger risks or challenges that we believe will persist after the launch of the system. I'll call out just a couple of these. Big organizational change for us to go from our legacy financial data warehouse to individuals getting the information they need directly out of Workday using Workday analytics and reports. That's a big change that we're supporting now. We will continue to need to support and educate on that change after we launch. Also, while we love our decision to go live on December, January, the middle of a fiscal year, it works great for payroll and human resources. It's not ideal to go live on finances in the middle of a fiscal year. So we recognize that it's going to be a little challenging for units to manage and watch their budgets for that first 6 months in Workday, the last 6 months of the fiscal year, because they'll need to be jumping back and forth between 2 systems. We'll be supporting and helping them closely. And then the last 2, I would say, have just risks that have developed more recently, really since the pandemic hit us and we've moved so many of our faculty and staff to working remotely. I would say that we're probably a little ways off from where we wanted to be as far as units really having their own local procedures ready to operate and support around Workday. I think we've made great progress there. I think the training will help with that, but we'll probably have a little more work to do there in sustainment as part of that change adjustment than we hoped. And I think that's just part of the adjustment of working remotely in so many locations that we didn't have originally prior to the pandemic. The last 2 slides I would just share quickly. This is a slide we've seen many times, and we're going to keep showing this slide till people are just completely tired of it. And this is, we're doing our best to adopt change management tools and techniques to help our organization minimize the duration and intensity of this performance dip that is inherent anytime there's a major change. We do anticipate that as we launch Workday, there'll be an increase in some frustration. The ways that great employees have worked for 30 to 40 years will now change, and it will take us a little while to help them adopt the training they've received and be able to function as efficiently, as effectively as they do today. So we're being honest about that. We recognize change will take time. We're recognizing there'll be some bumps along the way as we launch this, and we're here to help. And we can get through this as we work through it together with any challenges that might come. The last summary we share with leadership on the board today is that we've had great support on this project from our faculty, staff, and leadership at all levels. We're now going to begin rolling out some supportive messaging across leadership, across the university in these 3 areas. The first is that launch is coming soon, December and January. It's time to start getting ready. Number 2, we encourage folks to get involved. Take the training this fall. If you have questions, contact your Change Network member. In each college, we have many individuals here that have spent one-on-one time every month learning about Workday. They can answer questions. Go to the website and check it out. We've had calls from some other consulting firms that help universities implement systems. They've called and asked if they can refer their clients to our website because of the massive amount of detailed information that's out there and available for the campus community. Great information out there. We encourage people to get out and use it. And then the final bucket is some important messaging from leadership proper. And these are around these themes. We want to express appreciation for the many faculty staff that have dedicated countless hours and tireless effort to get us to this point. Let's recognize together a change of this size will have some bumps along the way. Our project plan calls for about a year of stabilization after we go live. We encourage everyone, especially in this COVID pandemic time, be patient with yourself and those around you as we work together to adopt to new systems and new ways of working. And finally, don't worry, we have your back. We're here to help. There'll be no blame, no finger pointing. Where there's issues, we will work together to get those cleaned up. So that was a marathon or a really fast sprint through some of the modernization update. Happy to take any questions. And then we hope to be back in front of the board in November, which will be our last official update before we begin using Workday.
Questions for Matt?
I just want to praise the work that's being done, having implemented a couple ERPs. They're really hard. Change management is a huge part of it, but you guys are moving this forward despite the pandemic and the budget challenges, and just really impressive. So great work.
Thank you.
I just, yes, I agree. Great work. And I want to express my appreciation to the board. This has been a 4-year project at a time when we were actually cutting back on a lot of our funding. You all allowed us to use some creative means to go find some dollars to implement something. So it's great that we're in that final stretch. And I think it's going to really help us transform the way we operate internally on an awful lot of things at the university once everybody's trained, it's fully up and operational. So anyway, Matt, you've done a great job. You, Stacy, and the rest of your team, thank you.
Thanks, everyone. Thank you, Matt. It's a great report. Long time coming, but we're looking forward to the finish line. Thank you. Information item number 8 is an update on the System Strategic Plan implementation. Christine.
Thank you. Hello, Regents, and I'm going to share here. Okay, so thank you so much. I really appreciate being able to present this to you today about the implementation of our first ever system strategic plan, because a lot has happened since you met last and you approved the plan. So during this presentation, I'll talk a little bit about the leadership structure that we have put into place to implement the plan, a little bit about our progress, and some of the upcoming activities that we are going to be engaging in. So at the last meeting, one of you asked, and I believe it was Regent Shower, my thoughts about how we were going to implement the plan or the structure for doing that. I did share with you in your packet a little bit about the leader or the actual leadership structure. And one of our first actions that we took was to define some roles and responsibilities of those who will provide oversight, management, and monitoring of the system strategic plan and the related initiatives, as well as facilitate our efforts for efficient and effective planning processes system-wide. So first, we established 3 groups to form a leadership structure. And just quickly, I'll highlight the focus of these 3 groups. We have the WSU System Council, the System Strategic Planning Implementation Team, and the System Strategic Planners Council. So the System Council is made up of President's Cabinet, deans, our vice chancellors from each of our campuses, So academic affairs, finance, research, student affairs. So its role is to oversee and monitor progress toward implementation of the plan and initiatives. And so, for example, provide direction for the determination of our annual planning objectives, which we'll talk about in just a moment. This group also plays an important role in championing the overall process of planning strategically across the WSU system. So the implementation team is a multifunctional project team. It helps provide direct oversight and management of the system plan. It really serves as a system, strategic think tank for the system council. So it's the key group that really works on the day-to-day development of the annual planning processes and implementing the system plan across the campuses, colleges, all of our functions and units. So I'll share a little bit in a moment about some of the activities this group is engaged in. The System Planners Council is made up of lead planners from across each of our campuses, our colleges and units. And so its focus really is to facilitate efficient and effective planning processes system-wide. So we think it'll meet about 3 times a year to share information, provide advice and feedback on what works, what doesn't work, some best practices that are out there, help to develop some action steps around processes as it is appropriate, and really to help move our processes move forward from year to year. So this group I see as building some connective tissue that will lead to consistent and effective approach to integrated planning, our integrated planning efforts. All of this requires an institutional commitment and the concentrated orchestrated effort of multiple individuals working in concert over time. So a little bit about the implementation team and the focus. This first year of our strategic plan implementation not only includes the development of action plans around our specific goals and objectives, but it also includes the development of a solid set of annual planning processes. Because what we're trying to do, in addition to selecting priorities and areas of focus for our next year or year and a half, is to build a system-wide culture of planning. So that for us means building a sustainable approach to planning that builds relationships, aligns the organization, and emphasizes preparedness for change. So right now, our areas of focus, immediate focus, include the following. So organizational and process alignment and annual planning calendar. So part of our efforts are to ensure alignment. And that's to develop, and one way to do that is to help just simply develop an annual planning calendar and a schedule that really outlines the process of planning system-wide so that all that plan understand what the process is and can align to that. So it's going to be a collaborative effort, particularly as we look out at how to better align the planning and budgeting that's driven by our mission. Annual planning review and refresh. This gives us an opportunity to reflect on our performance. Are we achieving our vision? Living by our mission, serving the students in the ways they need, meeting the needs of our external stakeholders and our partners in the state. What should we start doing, keep doing, change, stop doing? This is a time for us to really reflect on those issues. Environmental scanning, incredibly important. Annually, we need to take a broad look at forces or trends occurring outside of higher education and brainstorm how they might impact higher education in WSU to help us make those decisions on our annual planning and refresh. We need to develop goal teams. We've started that process, but these will be the teams that will help us focus on each of the 4 strategic plan goals areas and help us identify the specific objectives on which we will focus over the coming year. Stakeholder outreach and engagement. We've talked a little bit about this through the planning process, and the Regents have emphasized the critical importance of this piece, and we will continue to seek and use feedback from as many stakeholders as possible, both on and off campus. So we'll be developing a process around that can be sustained over time. And communications. So we intend to communicate broadly the process, the purpose, who's involved, how decisions will be made, our successes and our not successes, and to the campus community and beyond. So these are some of the priority areas in which we are focusing. So as I just mentioned, a critical part of the plan of the implementation is to select priorities from within our plan on which we will begin to focus over the next 12 to 18 months. Our annual process of planning will include thinking strategically to guide us in establishing priorities. So a little bit about how we did that starting this summer. So after we formed the System Council, we brought the members of that group together for this purpose. So during the discussion, we talked about the strengths and challenges of our system. We considered our system principles, the assumptions under which we are operating that are outlined in our plan and in which we have talked about over time. And we also engaged in a strategic thinking process around identifying our priorities. So following that retreat, the implementation team met and analyzed the feedback from the System Council and the feedback that was out there. So among the top priorities that emerged, and this isn't all of them, but I'll use this as the immediate example of what we were doing, were the following. The need to broaden our approach to outreach, extension, service, and engagement across the state. And along with that, the recognition that health sciences, for example, is working to realize the potential in this area. Also, the importance of focusing on priorities around equity and social justice. And of course, the important consideration of how we are responding to the impact of the pandemic. So the implementation team evolved this into a major topic for our October conference. And I think you've heard us talk a bit about the visioning conference that we are going to be doing every year. And we've referred to it as that, our annual vision conference. We've retitled this as the WSU System Strategy Series, which I'd like to highlight as an important upcoming system-wide event. So one of our goals is to continue to engage in ongoing conversations of strategic importance system-wide. Following our land grant symposium, and I think I brought this up a little bit in some of the past presentations, but we held that a little over a year ago, and we committed to a process of continued engagement and involvement as essential elements to the success of the plan's implementation. So in this particular session, our goals are to create a participatory process that all participants can share their knowledge, their perspectives, and their ideas to stimulate system-wide thinking, as well as thinking around specific goals and objectives of our system plan. We hope to come out with a list of opportunities for collaboration among faculty, staff, students in research initiatives, current initiatives, programs, projects that were presented and discussed. We'll develop event proceedings that capture the collection of ideas and thoughts and feedback that were shared during the full group and the breakout sessions. We will publish those to the community, and we will use them to inform the development of an action plan within the context of our goals and objectives of the plan. We really hope that people have an opportunity to learn about some of the ways in which we are addressing health at the individual and community levels around our state, including the social, economic, and cultural determinants of health in order to promote a healthy society and achieve health equity. Faculty, staff, students from multiple disciplines will have from across the system can work together to be more responsive to these physical, social, and emotional needs and goals. So, and also participation in the implementation of the plan. The knowledge ideas that everybody contributes during those sessions are very important. We would invite you to join us as Regents. We would love to have you join us. And if you're interested, just let Des or me know, as registration is required. But you can see some of the topics we're going to be talking about. And this is really where we are in our implementation plan efforts. I just have one more slide, and it's just to share with you what we are going to be doing. Obviously developing those plans, action plans around the focus areas that I outlined. We will be convening the System Planners Council as part of our efforts toward broad system engagement. And we will form working groups for each of the goal areas. The process we have started, and that will, of course, result in the development of some action plans over the next 12 to 18 months. And so with that, I would like to open that up to any questions that you might have, and I'll just stop sharing so I can actually see you as you might have questions.
Any questions for Christine?
Well, Christine, well done.
Thank you.
I know it's been a journey for you with a lot of different elements, and it's exciting to have something like this as kind of a guiding principle going forward. So thank you very much for keeping us informed as you've gone along here.
Thank you. You're welcome.
Indeed. Ron, do you have a question?
Regent Sims, yes.
No question. Mine's just a technicality. I spent this morning dealing with the issue of race in healthcare. And people say it's taken care of by culture, but culture could be, are you from the Philippines? Are you from China? And so in your study, I saw the language, you use culture. You need to acknowledge race. It is in this state, looking at the preliminary data, race is a very significant factor in both how you're treated and what your outcomes are. So if you could just make that small change, I would be one very happy camper.
I would be more than glad to, and I really appreciate that you brought that up. Thank you.
Anyone else? Thank you, Ron.
Brett?
Laura?
Yes. Hi. Chris, again, I give you great kudos, as Marty did, because it has been quite a process to do for the first time. I was really glad to hear that sort of at the top of your list for talking about things was the extension, and pleased to hear that the health sciences are really engaging in that. Do you have any thoughts on a timeline for when we might be able to see some major or hear about some major initiatives moving forward in that extension area?
So yes, so I think those will come in two places. I think we can share with you some of the things that are happening now, particularly coming out of the session, the strategy session, just in terms of current initiatives and how we are meeting some of those goals and objectives within the strategic plan. But in addition, we will put together a working group around that goal area. So goal area number 3 in the strategic plan really addresses that, and it talks about expanding the reach and the utilization of outreach extension as tools and channels for which we can, not just for healthcare, but to really, and kind of going back to a previous discussion of the regions, but for us to better integrate that within our system so that it is a much more, used, I don't want to say tool because it's much more than that, but for lack of a better word. So I'll have a better answer for you on an action plan. I don't want to overpromise. We hope to have action plans in place by the end of the semester, so you can see where we're going with that and to see what we are proposing around that. And so I hope that answers your question just in terms of timeline.
Yeah. And then I'm assuming that there are people very involved in extension as their job that are very much involved in putting this all together.
Very much so. We are working closely for the October 8th event. We are working with the Associate Dean for Extension and others within Extension. We are also working with Health Sciences and others on the team to help identify the right topics. And the idea here, just for that session, is not only just to, this is the examples that we have are a small sampling. There are lots and lots and lots of things going on. The idea there is to stimulate thinking around these topics and around our goals and objectives, rather than just sort of touting specifically about what people are doing, which is really, really important. But it is also important for us to use those as examples of ways we can do better and better partner internally and externally. How do we better impact and show our impact within the state? How do we collaborate internally and take advantage of the strength of our system? How do we seize opportunities for further funding by partnering with going concerns, those sorts of things. So these are all ideas to stimulate thinking around those so that they can be used as a template or a model for others to use. That's the idea.
Any other comments? Thank you, Christine. That's
You're
coming along. The next information item, Dr. Gonzalez wanted to report on the standards for conduct for students.
So I wanted to give you, we will be moving this to a proposed revision for WAC 50426. And for those of you who don't know, the United States Department of Education implemented substantive changes to the implementation under Title IX for the educational amendments of 1972. It governs all of our response to allegations of gender discrimination, which include sexual harassment, sexual assault, intimate partner violence, and stalking. And we've codified a lot of these changes into our Executive Policy 15, which then required that we had to make some changes, substantial ones, frankly, to our Student Code of Conduct. All these mandates were directed by the DoD, Department of Education. The revisions were undertaken collaboratively with the Attorney General's Office, the Center for Community Standards, and the Compliance and Civil Rights area. I want to be very clear with everyone that these do not change our behavioral expectations of students, but it does change the way we engage with students. I have a few that I want to identify for you. The first is that it changes the fact that we have to provide advisors for each party because now each party can be cross-examined by a conduct advisor. And so we are working through what that looks like for both respondents as well as those who are reporting the incident. Emergency suspension has also changed. In prior rules, we had the vice president authorize an emergency suspension, but now there's an appeals process. So that means that's going to the dean of students, and then ISVP will do the appeal so that Kirk, as the president, does not have to do that. That is only specific, by the way, to a potential Title IX violation, because that is what is required now. There is also a rule on hearsay evidence, which is where we heard the most feedback from concerns about students, is that certain evidence cannot be included in the hearing. And that means that if a witness cannot be cross-examined, then they may not be able to, their testimony will likely be excluded in the process. It's going to have a significant impact on whether or not the university can carry the burden of proof. And we are very concerned about that. But again, we only added the hearsay rule issue for conduct boards for Title IX violations only. The last one is related to intimate partner violence. And it is domestic violence and abuse of others. And so we had to clarify all those terminology. This does have a significant impact on how we will address domestic violence, sexual assault, sexual harassment. But again, that was a federal Department of Education that made that ruling that we had to adjust to.
Thank you, Mary Jo. Any other questions on that? Well done. Thank you. Information item number 10. Dr. Chilton will talk about a faculty manual change that was approved under delegated authority, Title IX again.
Yes, thank you. Obviously, this is connected to what Dr. Gonzalez was just talking about. I think you all know that in early summer, the Department of Education issued these new Title IX guidelines, and they went into effect August 15th. And, you know, just at a high level, the guidelines redefined sexual harassment, quid pro quo harassment, and sex and gender-based violence. And the effects of these changes will be overall to decrease the number of Title IX cases because they impose higher standards for violations. It'll decrease the number of cases that will require an institutional response, and it creates a strict grievance procedure applying to all Title IX cases, faculty, staff, and students. So in order to comply with the requirements, as you just heard, we were required to make some changes to student standards for student conduct, but we were also required to make changes to the faculty manual and human resource websites, as well as policies and procedures for handling the case. I did want to note that WSU has chosen to broadly address sexual harassment beyond the limitations of the Title IX regulations. However, for sexual harassment that meets the Title IX violation and jurisdiction definitions, specific hearing processes are required. So those are the ones that were changed in the faculty manual. Much of this work took place before I arrived. In fact, I was working on this for my previous institution up until June 30th. When I arrived here, I found that for the faculty manual changes, Senior Vice Provost Laura Greiner Hill had been working with the Faculty Senate Executive Committee, as well as our Compliance and Civil Rights Division. So you have all the details of the changes in your packet. I will just highlight for you what the main changes are to the faculty manual. First of all, the provost will rely on the investigation conducted by our Center for Civil Rights and our Title IX coordinator. Regardless of the outcome of that investigation, all parties will be provided a live hearing unless the parties resolve the matter through an informal resolution process. An elected faculty status committee will serve as the hearing committee, and the live hearing must offer equal rights to both the complainant and respondent. The faculty status committee cannot consider witness statements made outside that hearing process. And at the conclusion of the hearing, the faculty status committee issues its determination and sanctions to the parties directly instead of to the president. Both parties may appeal to the president within 10 days, and the president or president's delegate will review the appeal and determine whether to sustain the decision or return it to the hearing committee. All decision makers, the Faculty Senate Status Committee and the president involved must complete Title IX training provided by the Compliance and Civil Rights Office. The alternative to this approach would have been for the Board of Regents to receive the Title IX training and hear and decide on the appeals, but we decided on the latter. And then there are a number of really cosmetic changes, changes to the title of EP Executive Policy number 15 and the name of the Civil Rights Office. And those are all referred to in your packet.
Thank you. Any questions on the matter for Dr. Chilton? Thank you very much. The next item is also with the provost. Establish a Department of Community and Behavioral Health, future action item.
Right, well, thank you. So again, you have the notice of intent in your packet to create a Department of Community and Behavioral Health. This was submitted by Dr. John Tomkowiak, our founding dean of the College of Medicine, and Chancellor DeWald is on the call today, and he has been involved in this that has been discussed for some months, maybe longer. So I am hoping he will be on call to answer any questions that I cannot cover. I understand that as a notice of intent, that this will go forward as an action item in our November meeting for additional presentation and voting. So essentially, we propose to establish a Department of Community and Behavioral Health. This change renames our existing but inactive Department of Health Policy and Administration. Really, the current department title does not reflect the work of the faculty who are in it. And this would be more in line with national and international standards, and it would allow for the future development of both graduate and undergraduate offerings in behavioral and community health. I've been reassured that there will be no additional resources requested, that this is really an administrative realignment that will hopefully allow for the generation of new revenues through grants and other activities. Daryl, do you wish to say anything beyond what I have presented here?
No, just maybe a little bit, Elizabeth. I think you've covered it extremely well. I would say this is kind of a natural progression. Most of you are aware that we have a very large cohort of faculty who are already doing internationally and nationally recognized research in community, population, and public health. And this is a transition of those faculty into an academic unit that more appropriately represents the work that they're doing. It also allows, as Provost Chilton said, the development of academic programs, many of which have been discussed across our system. It would potentially be in public health, in population health, in community health. In addition, ultimately would be linked to or would embrace social work and other degree programs.
Thank you, Daryl. Any questions from the board?
No, but thank
Probably.
you on behalf of Daryl and Elizabeth too. We appreciate this. It's been a long time coming and lots of discussion has been held on this for a long time. So it's exciting to see it coming to fruition. So thank you.
Very good. Thank you all. Future action item number 2 is a proposed revision to the Washington Administrative Code 504-24030 undergraduate housing requirement. Vice President Gonzalez.
Absolutely. I want to thank all of you for this. This is referred fondly as our first year live-in requirement or freshman live-in rule, depending upon which era that you attended WSU. What it is that all first year students are required to live in university housing unless they meet certain criteria. We also allow in terms of university approved housing, students to live in fraternities and sororities as a matter of this policy. For this year and for this fall, we realized we had to do some edits to the actual policy itself to allow students to not live at Washington State, but count towards the first year live-in requirement. And so the edits that we made, we're making sure that we could do that. And we added a variety of categories, including extraordinary hardship, which allowed students who were struggling with financial or other means that to actually stay at home and count that year that they're living at home. For example, those who are living this fall in their parents' home, that would count towards their first year live-in requirement. And so we did that. I think it was the right call. It allowed students to do what they needed to do and to make those decisions accordingly with their family in mind. So those are the changes. We are making them permanent, by the way. We believe that from a equity and inclusion standpoint, that these need to be more relaxed, especially in the coming years. It does not mean that we're going to wholeheartedly eliminate it, but that we did need to create more of a process to do this, which really is institutionally focused and student-centered.
Thank you. Any questions on that matter? Thank you very much. We see that in November. Is that right? Yeah, very good.
Yes, you will see it in November.
Yeah, thank you. Future action item number 3, the Board of Regents meeting schedule for 2022. Dr. Schultz.
Yeah, I think we can make this really quick. This is just our meeting schedule coming up. So if there are any serious issues with it, please let Des or myself know offline. So other than that, Mr. Chair, it's, I think, pretty much ready to go forward.
Thank you, Mr. President. That takes us to action item number 1, the President's 2021 goals and objectives.
These have not substantially changed since June. I tried to keep the list more broad and as opposed to a 3-page list of things to do. We modified a couple of the wording based on some feedback we got, but largely this is the same thing I presented to the board in June.
Any comments before we move on? Thank you.
This is Brett.
Laura.
Just one
sure.
comment. When I looked at this and also then looked at the athletics budget and understand all that were going on, the first bullet that says meet target spending levels for WSU athletics for 2020 to 21, I feel like, Kirk, we're setting you up for failure. With that bullet, the way it's worded.
Yeah, I still think that, and I know we're going to have a discussion. Thank you, Laura. We can modify the wording on that slightly, and I can do that tonight to reflect some of the discussion that we had this morning, as well as whatever discussion we have a little bit later around that athletics budget. So I appreciate that.
Yeah, Kirk, I would recommend that we do modify it. I'd like, that we modify it to be something that's more in line with the direction we ultimately take, that you are helping shepherd that direction. But that's a really nebulous kind of statement to Laura's point of that can mean a multitude of things. So the way it's worded right now.
Duly noted. Well, by tomorrow, we'll have a suggested change in what that would be before you all have to approve it.
Thank you. So the next action item would be a revised 2021 athletics budget with Stacy and Director Chan. Who wants to go first? Are you ready, Stacy?
Yeah, I'll go first.
Yeah.
Think, based on our discussion that we've had, actually, maybe what I'll try to do is share the screen. And a couple of things I wanted to show. Number one, this is what we typically give you, the historical budget. And this is for the year that we just closed and the last 4 years. And I guess what I would point out when you look at the line on net income from operations is that certainly the progress was being made that we hope to see. In fact, in fiscal year 20, once we actually closed out, the deficit was much lower, due mostly to increase in contributions, as well as the fourth quarter reductions in expenses from not competing. That took a while for that to kind of sort through. So that's certainly the good news, that if not for COVID, even with COVID coming into play late in fiscal year 20 and having some of the competitions canceled, that they were able to do that on their operating budget. Just a reminder, these capitalized expenses here on this line just means up here in contributions, some of those are operating contributions. I think quite a few of them are capital contributions. So that's why we make sure when we spend that money. And in this case, in a fiscal year 20, you're seeing the expenditures on the baseball clubhouse that makes that balance. So again, pre-COVID, I think that we can really laud the efforts of Pat and his staff in working diligently to reduce that. This next attachment B, of course, is it carries forward the unaudited figures for fiscal year 20. And then what you approved, the original budget for FY20, in which we were planning that there would be a $5 million deficit as we work toward these figures over here, which was to eliminate the deficit by fiscal year 23. And so that budget was reflective of what we expected to do in the current fiscal year. That next column, September update FY21, does reflect that that deficit amount has grown by 25 million. And again, that's in various line items. So if you just go through each line item, and I'm sure Pat will want to speak to this, but I think ticket sales would be obvious. The NCAA Pac-12 is the large one, the reduction of about over 16 million on the revenue side, and then some smallers on the other revenues. And then the expense reductions of 5.1 million are here. I think if you've read the press release, that expense reduction has since been increased to 6.5 million, not reflected in these documents, but will be reflected as when we bring the budget back in November. And again, this has been a tough one because things have changed fairly frequently as we've tried to kind of nail down the numbers and what's happening with the competition season. So I wanted to point out just what has changed in the budget and in those areas. And then I'll take your questions, but I think maybe Pat wants to speak to kind of all of the activities since then.
Yeah, thank you, Stacy. And first, I appreciate everyone the opportunity to have dialogue about our budget. I would like to publicly thank our coaches and our staff for their commitment to Washington State and the collective sacrifices they have made in an effort to help us move forward. I'd also like to thank Teresa Elliott Cheslick and Erin Hansen from our university HR staff. The time, the advice, the counsel they've given us these last really month and a half or so has been immeasurable. And to Stacy Pearson and Matt Skinner, to have great working partners that are solution driven, that understand that we don't the answers that some of us may be looking for. Most especially me and President Schultz, just need a little bit more time because of how dynamic the situation is. So just as a reminder, our situation in the athletics is dynamic. Just as a point of clarity, the materials that were submitted to you did change because of our announcement last week, because of the delicate nature of the personnel actions we took, position eliminations, communicating all the pertinent information regarding furloughs, voluntary decisions about salary reductions. The timing of when the materials were due did not align with the timing of these actions. So I'm hopeful for your collective understanding. As you can imagine, this has been a difficult stretcher in the Department of Athletics with the types of conversations we've had to have really over last month or so. As we've made all of these adjustments to our budget, at the forefront of our decisions, we have not wavered in our commitment to our student athletes. Our changes by design and by goal are hopefully will have minimal impact to all the services that we define as the most impactful to our student athletes, especially in the current time being. So we've made minimal changes to our academic support, our mental health and counseling services, sports medicine, strength and conditioning, nutrition, life skills and professional development programs. These are the key parts of our student athlete development program that really we've really took a hit on the external side and really focused on what we can salvage on the internal side. We've put a premium on the health and safety of our student athletes. Working with Colleen Kerr and campus, we've adopted very strict, and the Pac-12 and NCAA and everyone involved, we've adopted very strict COVID-19 protocols. Like campus, our COVID-19 tests are trending in the right direction in terms of the number of positives continue to drop for athletics. So we're on a positive trend line there. The clarity on football does have the greatest impact on our budget, specifically our conference distribution. The discussions are ongoing regarding football season, whether it's this calendar year or next calendar year. But the availability of quick response, saliva-based, point-of-care daily testing was a game changer, is a game changer for the Pac-12 and Washington State. We have a lot of work to do as a league to arrive at a consensus, but we're working towards making recommendations in the very near future to Kirk and his fellow CEOs in the Pac-12. We also still need clarity on men's and women's basketball. The NCAA announced yesterday a uniform start date of November 25th. Right now, we're postponed until January 1, but this will be another item that we'll make a recommendation to our Pac-12 CEO group. So we're laser focused on any and all opportunities for additional revenue. That football piece is the most significant one, and that's where we need time and more clarity on. We're focused on fundraising. I appreciate Stacy mentioning that before. I mean, just to provide some context, we had back-to-back record years in fundraising, and last year we doubled it, and that was a record year. And for an institution in athletics that consistently finished 11th or 12th in the Pac-12 and overall fundraising, it was given to me yesterday. We actually finished 5th in the conference with our $27.7 million in fundraising last year. So we made a concerted effort to really redefine what fundraising meant for athletics. We built a staff that understood what metrics that we're going to operate out of and what goals were in place. And, prior to COVID, we were trending in a really spectacular direction regarding the fundraising piece. So also, I'd like to take a moment to thank Kirk and Regent Dickinson for their time and the open lines of communication. And, I understand these are very difficult, tough discussions, but, for us here in athletics, we're just appreciative of the leadership that we have that allows us at least to go through our strategies and where we're at and have open lines of communication. So I can pause there, and obviously Stacy or I could take questions, unless Stacy, there's anything else you want to add.
I guess what I would just add is that, we are looking at what options that we have for, look for such an extreme change in the budget situation. It's just not easy, because what it does is it moves you towards some type of a debt vehicle, and I think that just has to be considered very carefully. And as we've done with all of the university's debt, we carefully structure about how we repay and all of those things. And certainly if the situation can change so that we're back in competition, whether it's in the spring and certainly in the fall, what it does is stretch out the amount of time that it probably takes to recover from this. So as I indicated, while we were on track to at least eliminate the operating deficit in a couple of years, we just really have to think strategically about what this new environment does in terms of how we, quote, deal with that deficit. So it's not for lack of trying, but just understanding that there's really pros and cons to the different ways that we might address this, either through a Pac-12 loan or something else. And so appreciate the time for us to be able to consider what the best approach is, as well as understanding that a decision has been made today about competition in the spring, but that may continue to evolve. And if it changes, we have to be able to respond to that also. So, we've certainly modeled some worst case situations, but, at what point, it's just like with what I presented to you earlier, we probably have the ability to go out and borrow more, but is this the right timing, to do that? And so I think that takes, we need to work more with both, the Pac-12 situation as well as with our financial advisor to really come up with the best plan.
But that being said, we legally need to do something tomorrow. Is that why you brought this forward?
Yes, I brought
consider?
it forward because of the way the legislation reads about a change of 250,000 or more. I'm sorry, I don't have it in front of me, but if I recall, that requires Regents approval.
I think though, Chair Blankenship, that at least several of the Regents expressed that they wanted more details about how we were going to handle that additional deficit amount of money, and we're not prepared to do that today. So if that's the case, then what we need to do is we will schedule a meeting in a couple weeks where we would bring back a little more solid proposal on exactly where those dollars are going to come from and how we propose to do that for the Regents to look at that particular time and either approve or send us back to the drawing board.
Chair Blankenship, this is Marty. I'd like to actually see if I could is Colleen available to just perhaps give us her perspective in following back to, I think somebody's prior question of wanting a little more context behind Senator Billig and kind of where he's coming from. Could we ask Colleen to perhaps shed a little more light on that?
Sure, thank you.
Are you still on, Colleen?
Yeah, I am, Chair Blankenship. Sure.
Thank you.
And I believe, Regent Swerna, you asked the questions, and I think it would be helpful to provide a little bit of context. So we have been having this conversation with Senator Billig for about 5 to 6 years. It's important to note that it predates President Schultz and it predates Pat Chun as our athletic director. Senator Billig has been really reasonable with us. He has worked with us to avoid legislation that has been, to prevent it from being overly punitive, and also allows us to continue managing our athletics budget. And I raise that because there have been other members and there have been other questions in terms of where would that management lie, and proposals that would include bringing it to review before certain legislative committees. He has accepted and he has been very understanding that old decisions can't be revisited. And he's taken us at our word that we would start paying down the athletics debt. And we have all acknowledged, President Schultz has talked about that today, Vice President Pearson, Athletic Director Chun have all talked about that today. We had been making really good progress on that until we were hit by COVID, which is a unique challenge. What he has expressed some concern with is overly optimistic assumptions for fundraising, for ticket sales, and that those are not accurately factored in a way to have a break-even point. And so he has been really consistent about that over the years. The one thing I will say, so like Regent Dickinson and President Schultz, I have been in communication with Senator Billig as well over the past couple of days, and I want to be careful not to speak for him. I think it's important, though, to relay his perspective just from the office that I hold for the university. And Pat's point is really well taken. We simply have had a timing situation with respect to internal notifications and Regents notifications, and that happens, and those were not able to come together. And that has resulted in a situation where I think Senator Billig is asking the question and is letting us know that he feels uncomfortable with a budget, or that you would take action on a budget when we have had that situation. And I believe that's what President Schultz has been speaking to. So I'm happy to take any further questions. I hope that provides some context.
Colleen, I have a couple questions, just in terms of kind of, first, I appreciate that context. That's helpful to understand maybe what's going on behind the scenes and how that impacts where we are today. As I look at the accumulative deficit of 114 million, and recognizing clearly that we were on an impressive path, and so proud of all of the efforts that Pat and Kirk and the team has moved forward in all of our areas of focus in the athletics, but this one in particular. It just gives me pause as I think about an overall strategic approach to our funding strategy with the legislature, and Senator Billig's concerns about our athletics budget. Could you speak at all to the impact of perhaps the action that we might take tomorrow on the other initiatives to ensure WSU funding moving forward with the legislative session starting in January that is budgetary focused? Feels like they might be connected in some ways, and that gives me a little bit of pause to understand a little bit more.
Sure. I should have led with this. Our Spokane campus, which is a statewide health sciences campus, that is in the 3rd legislative district. That is Senator Billig's district. So we are very much one of his constituents, and he is a part of our core delegation, which is what we would refer to for any of our campuses. He has been a champion for the medical school. We would not have a medical school but for Senator Billig and for Senator Baumgartner, now the Spokane County Treasurer. And so I think for both of them, they have then had higher scrutiny, because we've asked a lot of money for the legislature to publicly fund our medical school. And it's important to acknowledge that the state has publicly funded it. The decision packages that we have submitted this week include, even in this climate, that we have asked for full funding. And we will continue to move forward with that, and we will work with Senator Billig on that. To the extent that there is anything directly, I don't believe that there is. And we want to look at the overall requests that we're making and the decisions that we make, because certainly Senator Billig is doing that. And he looks very, very closely at all of our, all aspects of WSU, truly. And I want to identify that, because we do have some new regents here. One of the things that Kirk and I have talked about over the years, him having been in other states, me only having been here in Washington State, is we're really lucky in the state of Washington. We have very sophisticated legislature. We have members of the House and the Senate, both Republican and Democratic, who are very sophisticated and who come to public service truly from a place of public service. So they are successful in their careers and in their communities, and then they come and they bring that expertise to bear in terms of how they lead the state. And so I would attribute that very much to Senator Billig's perspective.
I think the question that's kind of haunted me as I looked at the numbers is, at what point is this deficit too great to not look at some dramatic, I have no idea what that means, but some other solution, given we just don't know what is yet to come. And I think we all had hoped that we would have students back on campus in school in the fall. And I don't know how soon that'll be, which means that there's obviously a ripple effect with athletics. So I just get really uncomfortable as we get up and over $100 million deficit.
I want to acknowledge what Regent Dickinson said, and I don't want to leave her being the only person to carry that message, because a number of us have communicated with Senator Billig, and we have seen previously that he has engaged in legislative action to support you as a Board of Regents on this matter. And I think that it is reasonable to expect that we could see some type of legislative activity in the future. I don't know what that would look like, but I do think that we could, that is in the realm of possibility. And I believe that's what Regent Dickinson was indicating.
And then Lisa, if I can add, the personnel actions we made are unique to us because we have the lowest operating budget amongst the Power 5 conferences, lowest number of full-time staff. So for us, although eliminating 10 full-time positions may not be what some other schools have done, it's significant when you don't have as many staff as other people. I'd also like to add where we sit as an athletic department today, we're one sport over the NCAA minimum. To be Division I FBS, we currently sponsor the sports required to be in the Pac-12. Also, we are Title IX compliant as we're obligated to be. So as we talk about where we sit, I mean, athletics and how it's structured is structured appropriately and compliant with all the rules that currently govern us.
And I appreciate that. And honestly, the talking points that you put together in July was very beneficial to look at in terms of where we are and the historical graphs of this deficit. I think some of the comments that you made early on about some of the cuts, Des just emailed the press release. So I had not read that. So there's another missing piece as this thing is evolving so quickly in terms of some of the other dramatic steps that you've had to make. So I appreciate your leadership in this time. This is not an easy moment at all. So thank you.
I would say with my conversations with Senator Billig, he does acknowledge the cuts, the drastic measures being taken. He acknowledges the transparency that has been provided by Pat and Kirk and Colleen. I think he's getting to a deeper place here, and where he's at is he recognizes all of these things that WSU has done. He is not critical that that you haven't taken steps, or that we have not taken steps, I should say, which is leading him to actually have more concern and greater angst in that if you've done all those things and you're still sitting at, this accumulated deficit, where are the regents? I mean, he's asking that question, everybody. Where are your regents, Marty, in how they are responding to this? And, I am assuring him that we're having conversations about this. But again, one of the questions that he specifically wants an answer to, and I think that the right approach, Kirk and Stacy and Pat, is to take a pause here and just step back for a minute. And I've talked with him already back and forth, and he likes the concept of us taking a pause and maybe coming back in a couple of weeks with a little more clarity. We're scheduled now to meet with him next Wednesday, which will be a good place in which we can talk to him perhaps about the things that you might be considering. But what I think, and Stacy, this is where, again, we as regents don't fully understand, and I think Laura was articulate in this too, of there's just a lot of things, right, that you can't touch that are contractually obligated. And so when there's a question from Senator Billig of, well, what are you doing and how are you using your operating budget, your existing operating budget, to be helping the athletics versus tapping in to the auxiliary funds on a regular basis? Because that is a big source of pain point for him, is how we use those auxiliary funds to shore it up despite us paying that back. I think we have to just be prepared for how we respond to some of those questions that he's been pretty clear about. I didn't think and I didn't anticipate when I asked him, because I think somebody asked this question. I was very specific with Senator Billig and said, and I think maybe it was Regent Redmond, what are we not doing that you would like to see us doing? And
as I said, I was not prepared for him to come back with some of the very kind of pointed recommendations that he is suggesting that I don't believe are starters at this time. So we've got to kind of work through kind of our whole toolkit. And I know that you guys already have. That's the part that it's like, ugh. It's not like you guys are just kind of shrugging your shoulders. And I mean, I know the depth that is of scrubbing this thing that everybody is doing right now. So it's a heavy lift, you guys, and it's a heavy thing. And I appreciate Colleen's perspective on it. And but I do think there is a real correlation, Lisa. I mean, Andy's got to be, he's a politician and he is a Senate Majority Leader, and he has not just his district, but the state to look out for. And we've got a university inside of this region that is struggling for some very similar reasons around decisions that may or may not have been made around a football program called, and that's another institution. And so it's just causing a lot of angst and a lot of light that's being shed on, our athletic department, fairly or unfairly. It's the reality we're dealing with right now.
I know we're, somewhat wanting not to alarm anybody or start, making things crazier than they already are. And in times of crisis, it's good to stay calm and look at the big picture and the long haul. But I do think we do have to have an honest conversation in a couple of weeks as regents of what are the menu of possibilities, including the ones that, Marty, you're labeling as non-starters, because we need to identify why they are non-starters and document that. That's our duty as board members. So, and maybe we'll discover something along the way that we don't currently think, but we have to dig deeply into the spectrum of actions that one could take and then decide based on all the evidence what the right course is. And I don't feel like we've had that open dialogue yet or been presented with those alternatives and the pros and cons. And I would suspect, Senator Billig, I know there's lots of things going on with the balance of power in the legislature right now. So I don't know, sort of who we're going to be dealing with longer term, but I'm sure that, sort of the state as a whole will be really asking everybody sort of what are you spending on, what are you not spending on, and what are the sort of the hierarchy of needs, and how do you justify spending on this versus that. So, I think we do need to have that conversation, and I'm grateful for the opportunity to do that, I guess, in 2 weeks before we take a vote on this budget.
Thank you. We'll be ready to come back with some solid ideas. I also want to provide, in my view, a little context around this. The university, before I arrived, made a decision to do some substantial investments in our intercollegiate athletics program without clearly identified streams. And so I want to ensure the board remembers Pat, myself, and others kind of came in the middle of this. Those decisions had already been made. And this is the important part. The university also elected to basically cease supporting intercollegiate athletics. We expected them to do a standalone type of operation without those incomes coming in. A lot of other schools like us would be doing the same thing, for example, like Eastern Washington or somebody else does, where they actually partially fund or wholly fund out of other resources their intercollegiate athletics fund. We give like almost zero. And so solutions are things like the university stepping up and providing some base level funding to intercollegiate athletics. That has not been done for a while. Not everybody would agree with that, but there are some things like that other schools that would be kind of in our budgetary range do. It's great to look at Ohio State or Florida or Alabama and say, see, they can have a self-supporting operation. We may not be able to do that. So my frustration with a lot of this has not been the scrutiny, and it's not that. It's people want us to wave a magic wand and make something that took a decade to get us here disappear overnight. And none of you are asking that. It's just, this is an important part of WSU. And at some point, I think it's important that if we acknowledge it's an important part of WSU, then just going to athletics and beating them more, saying you guys got to fix it, is not going to be the complete solution. So we'll bring forward some ideas and for you all to look at as regents, but some of them may not be super popular internally, but those may be some things that if intercollegiate athletics and being a Pac-12 member is valued, that's going to be the steps that we're going to need to be able to take.
Kirk, would you maybe agree with, you don't have to answer this, but I do think there is an element that Senator Billig may be pushing on this, and because he's acutely aware of the fact that WSU's intercollegiate athletics has to kind of stand alone. And there's part of me that, so we get frustrated with him and like, why is he kind of so fixated on this? And then I also have to put my hat on to think, well, is he being strategic potentially to kind of help force the hand of that conversation around maybe reevaluate that structural kind of setup that was determined, prior to you and to Pat and to most of I think to all the regents that are sitting here today. So, is he trying to perhaps kind of give some room for us to have that conversation, and perhaps he's willing to kind of carry a bit of that burden of, well, I'm the one that's forced the hand on that. So I don't know. I mean, it could be a strategy. I don't know, but that is certainly, Heather, one of his definite options that he's putting on the table. And also, Pat alluded to it. We are one sport away, from if we cut a sport, how that impacts us to stay in the Pac-12. I think that it would be interesting to have a good understanding of the ramifications if you were to not stay in the Pac-12, what that looks like from a revenue standpoint, and then an alumni support standpoint, because I think that there's some value in dollars there that we can't even begin to equate. So.
Yeah, I think we do have to look at the not being in the Pac-12 scenario, because I suspect that it would cost us a lot. But we haven't looked at that. So we need to have that looked at and documented. We've just sort of treated it as a foregone conclusion, because I think it is, once you look at the numbers, but we better have the numbers to support that.
Regent Cerna, did you have a comment?
I wanted to ask Pat Chun. I had seen an interview, I think it was last night on ESPN with the head of the Pac-12, and I was just wondering, is there a timeline, I guess, on whether a decision will be made soon about playing this year?
We're studying models. These are ongoing discussions. The partnership with the daily testing fulfills a key point with our medical advisory group. So we're working on some models. The goal is to present something to Kirk and his fellow CEOs in relative short order. But we number one, first and foremost, our student athletes want to play. I think that's driving a lot of this. Every single member of our football team I've spoken to directly wants to play and wants to play this year, if at all possible. So and then this health and safety piece has always guided the Pac-12 as we made decisions relative to all of our sports. So the testing piece is in play, obviously, with the Big Ten going forward. We're now the only Power 5 league that isn't playing football. So there's a bunch of other pieces in place, but the goal is to make some type of recommendation or have dialogue with the CEO group in short order.
So Kirk, I think what I had heard too, that California and Oregon had, I guess, gotten the okays from their governors on some of this, but would you have to go to Jay Inslee in the state to get him to go along?
There's in the last 48 hours, there's been a tremendous amount kind of out there in the media about all of this. And a lot of it comes down to local public health in areas where the universities are. And so there's also, I think, some posturing going on where people want to say, hey, I'm not the person kind of holding this up. And so we're meeting as a Pac-12 CEO group tomorrow. This is a large topic of discussion, and we'll sort of see where things go. I don't feel that Governor Inslee or anybody in Olympia is holding us up from this kind of stuff. It's us deciding what we want to do, putting a testing plan forward that's safe for our student athletes, and a timeline. And until that's done, a lot of this, I think, is just a little speculation on people's parts.
Regent Cerna, and let me just say this really clearly to alleviate a little the question. The Pac-12 has been great in terms of acknowledging that these decisions are made by the governor. And so it's us with the University of Washington are working closely with the Pac-12 and with the governor's office, but the decision is the governor's. And so to the extent that communications come out from the Pac-12 that sound otherwise, that is unintentional for sure. And it is on all of our radars.
Okay, thank you. And also thank you for the background earlier on, although it's still confusing as hell, so, It's fluid, people. Yeah.
Yeah. Any other questions or comments? Well, thank you, Stacy, and thank you, Pat. We really appreciate the update and clarity. So there's one more action item to discuss publicly, and that was a potential delegation of authority. And Dr. Schultz can comment on that.
Yeah, we have the need to appoint at times members of the Board of Regents to the foundation, the WSU Foundation Board of Directors. And in the past, for example, Scott Carson sat in those seats, and for a long time, we didn't even have to deal with new appointments. And so we just thought it was really more clean to just delegate authority on this particular one, so that we can just go back and let you know who we decide. But I think, Brett, the idea was to be able to have you as chair be able to manage those particular appointments. So I don't think it should be terribly controversial. This is just a good way of doing business.
I think our discussions were, we thought that's the way the bylaws read, and the chairs just nominated those. But this cleans that up if the board concurs. So that's that item. We have an executive session scheduled at this time.
Right.
And while the
Can I do one thing before we?
Sorry.
Folks, I would just say we've all been taking notes, and there's a lot of action items from today that are not future action item type of things, but things that I think are expectations of the board to leadership. And if you just indulge me for a minute, I'd like to read through my list to make sure that I've got and reflect this. We need to be doing a memo in terms of how we're innovating during this time and how we're making positive use of COVID-19. It's my responsibility to get a 2-page memo back out to the regents the next few weeks. Around the head count, it would be great to have a sense of historic trends on head count, who's in what category, where we're hiring and where we're putting people. For any sort of new dollars that come in off of redoing some of our bonds, we need to come back and talk about how that money would be used or utilized if that's approved by the regents. What dogs are not barking? What are our really long-term plans around COVID-19? Not spring semester, but where we look 3 to 5 years out. What types of things do we need thinking about? Next, we need to include stats on COVID-19 reports to the regents on a weekly basis, so you all see trends and some graphs about where things are going. We need to schedule risk management discussion surrounding risk in conjunction with the Board of Regents and our risk management staff. A broader conversation, more a retreat setting than a report out setting at a Regents meeting. And then I need to change my athletics budget goal. And then finally, we're going to reschedule a meeting in a couple weeks to specifically at that time be able to do more with the approval of the athletics budget moving forward. I think that's 1, 2, 3, 4, 5, 6, 7, 8 items I had based on our morning discussion. Did I miss anything? And I may not have phrased it right, but that's at least what I had.
Kirk, I just want to clarify on the one about using the proceeds from refinancing of bonds, et cetera, because at least my suggestion was certainly if a direction you plan to take requires any of those things which trigger a discussion and perhaps an action by the Board of Regents, that you would come back and do those. But I want to make sure we're not micromanaging you. I guess that's my concern. So just be careful how that gets. I think some caution about how that gets worded, because we have our natural triggers of when you need to bring something to us programmatically, operationally, and otherwise. And there's delegations of authority. So I just want to make sure that we're staying within those bounds.
Yeah, I took this more as a high level discussion around strategy than it was.
Okay.
Tell me how you're going to spend 5,000 of this and 10,000 of that, which I think the board should be engaged in those strategic type of conversations. So,
okay, that sounds fine. Yeah.
Thank you, Mr. Chair. Thank you. And if anybody has other items or I missed something, please reach out to me directly. And I've got to go to the bathroom, so I'm going to turn my camera off. Yeah. I've been sitting here squirming for 2 minutes for an hour. So sorry, that may be more information you want, but I know we got to do an executive session.
So we have an executive session coming up, and I had this similar idea as the president. And so in 5 minutes, while they set up our side room, I will reconvene the executive session. And before the public goes, the executive session will probably go around 30 minutes. So I'll say that now. Thank you. We'll resume.
waiting to go.
Very well. We will now hold an executive session to discuss with legal counsel litigation or potential litigation in which the university is or could be a party. This session will be closed. The executive session will conclude at approximately 1:50, unless it is extended by further announcement. If any action is taken as a result of these discussions, it will be taken tomorrow during open session. We will now go into executive session.
For the Regents, you won't need to do anything.
Thank you, everyone. The Regents are still discussing potential litigations, and we will be in executive session for 10 more minutes. Thank you. Hello, the Regents are still discussing litigation, probably another 3 to 5 minutes. Thank you very much. The Regents litigation discussion is continuing, probably another 5 minutes. Thank you.
Brett, we can see you moving around. Are you, but I can't hear you.
Were you talking to me, Kirk?
No, I said I could see you moving, but I couldn't hear you. I didn't know if we were back in session or what.
Well, we were yakking. I thought I adjourned the meeting, so I was. So if there's no further action, we stand adjourned until 8 a.m. for our regularly scheduled meeting. Thank you.
Thank you.
Bye-bye.